Going to go ahead and call this July 6th, 2020 meeting of the Whitefish City Council. Thanks everyone for coming this evening to participate in your government. We'll start with our Pledge of Allegiance, and I'll go ahead and ask Heidi, do you mind leading us tonight?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thanks very much, Heidi. We'll move on to communications from the public. This is time set aside to share with the council anything that's on your mind. It's not a time for question and answer, but if you are here for one of our 3 public hearings, please wait until I call that individual hearing to come up to the dais and provide comment, please. With that said, any communications, you're more than welcome to approach the council, and just your name and address for the record, please.
Hello, friends and neighbors. I'm Jeff Elliott, 1009 Park Avenue. And I do not want to be here, but I felt compelled to express my disappointment in the inaction that we received from the city concerning the play Moana that was staged in my backyard. We went through the month of June with increased traffic every day, never knowing that the intent was to host productions at the site. We didn't find out about these productions until 5 days before the first one, and by then it seemed that if it was just too late to do anything about it. I reached out to Andy, called Andy on Monday, a week ago Monday, and Andy talked with Dana Smith and got back to me, and she told Andy there really wasn't anything that the city could do. It was on private property. So the next morning I called Dana to try to help her understand what was really happening down there. It seems as if there'd been some false information provided. And my simple request, the only thing I asked was that could somebody come down and look? I asked council, send somebody, come look. I asked Dana, please just send somebody down. You know, you don't have to believe what I'm saying, just send someone to look and see if what's going on here is as it was presented to you. And no one came. Their access got rained out, pretty much destroyed because it's undeveloped. And they called in a dump truck and they dumped an entire load of gravel at my gate and spread it down the hill. Now suddenly everyone could come and go as they pleased. And the traffic increased and the speeds increased, and still no one from the city came. So I could go on, but I won't. I just wanted to make the point that we asked for help. We asked for assistance from the city, and we received none. So I guess that's all I needed to express. So thank you for your time. Appreciate this opportunity.
Thanks, Jeff. Who's next? Yep. Just name and address for the record, please.
Yes, I'm Clyde Dix, D-I-C-K-S, 1001 Mountain Park Drive. This seems very trivial compared to some of the more important things that we've got going tonight, but I'm here about item number 11A, which concerns potentially putting some speed bumps up towards the Lion Mountain Loop Drive. A petition was circulated by a Mrs. Heitzman, and she's not able to attend tonight, but her and I are on the same page, and she has written a letter that you should have in front of you confirming what I'm about to say. Initially, we thought of putting in some speed bumps, and then we reconsidered due to several factors, and so I just want to make sure the council pays attention to the factors that we came up with as to why we think a three-way stop sign would be better than speed bumps. And just super quickly, one is noise, just the constant thud of tires going over speed bumps, whether they're obeying the speed limit or going quickly, and especially vehicles carrying trailers with building materials, rebar and that sort of thing. When a trailer goes over a speed bump, it makes a heck of a noise, and that's from early in the morning until late at night when people are coming back from town. Second of all, cost. We think that a three-way stop sign would be a one-time cost with no additional annual adding and removing of temporary speed bumps that you would have to do in the fall and the spring. So we think that a stop sign was a more cost-effective option. Safety, we feel that speed bumps would potentially affect cyclists in a more dangerous way than a stop sign. And then lastly, effectiveness. Some people in very large vehicles unfortunately see a speed bump as a challenge, and honestly, we have Jeep Wranglers and Hummers and stuff going by there, and they don't stop. They don't slow down at all for a speed bump. In fact, some of them enjoy going over as quickly as they can. So in summary, I just wanted to ask the council to look carefully at those points and understand that Mrs. Heitzman and myself and people that were involved in that request have changed from requesting speed bumps to requesting a three-way stop for speed abatement in that particular location. So thank you very much for listening.
Thanks, Clyde. Who's next?
Due to anxiety, I can't breathe and talk at the same time. So thank you for the opportunity to once again talk about fireworks. And due to not having fireworks at City Beach this year, our police were able to respond to the calls from citizens who are being disturbed. And we are a community, as it says up there, that cares about the health and well-being of our citizens. We are breathing a lot of ash. Oh, sorry, I'm Sonia Smith. I live at 265 Colorado Avenue, apartment D9. And every year I make numerous calls to non-emergency police. In fact, this evening I called at today, July 6th at 6 p.m. Another bomb went off, God knows where. I had Marcia at the Whitefish Police Department prepare a document showing how many calls have been made with fireworks complaints. And she started it January 1st of 2019, continuing through July 5th, that was yesterday. There were 115 fireworks complaints during that time. There were 57 complaints this year alone between June 19th, which is illegal, beginning at 11:30 at night, it looks like, and then continuing on through July 5th at 11:30. On July 4th, after midnight, I was awakened at 2:30 in the morning, July 5th, with another bomb going off. I learned from one of my neighbors that there's a group that comes from Seattle, Washington, because it's banned in the major cities in the state of Washington. And then the smaller towns allow people to get fireworks permits for $100. The small towns like North Bend and Puyallup and so on. I do not like it. I resent that our town is being turned into this party mecca. And I would appreciate it if we would just have fireworks prepared by the professionals on July 4th once a year, not any within city limits, by the citizens who cannot be responsible and not bomb people. We do care about our health. And this document that's part of the Whitefish, whatever, defining fireworks, who thinks of these names? How much gunpowder is being pounded into these helicopters and Roman candles? What is happening here? This is not fair. I have not slept for 6 nights, and it's quite obvious. I hate fireworks.
Thanks, Sonia. Who's next? If I might just remind folks, we have a rather lengthy meeting and 3 public hearings, so I am going to try to limit public comment tonight to 3 minutes, please.
Okay, thank you. I'll try to be brief. My name is Dave Von Kleist. I live at 436B West 3rd Street. You may recall I was here 2 weeks ago, and the circumstances tonight are a little bit different. I feel like I'm mourning 2 losses right now. Dennis B. was a very good friend of mine and very close, and he and I worked together on many different projects. And I feel that his loss is a loss for the entire community for several reasons. The second reason that I feel like I'm mourning is because we just celebrated Independence Day. We all just stood just a few minutes ago and took a pledge to that flag and the nation and the republic for which it stands. And that includes standing up for the Bill of Rights. You've all taken an oath. What's happened in the past 2 days is unnerving. I want to play, you all should have a copy of the email that I sent to you earlier today, and I could go over the many different points and the sites and references from the CDC and the American Medical Association, etc. For those of you who weren't here 2 weeks ago, I will preface this by saying I've been a broadcaster since 1979. I was co-spokesperson for the American Gulf War Veterans Association. I testified before the Presidential Commission on Gulf War illness. I logged over 7,800 hours coast to coast nationwide on the network on AM, FM, satellite, shortwave, internet, and XM radio. So I have a little bit of a background in broadcasting, and I know a little bit about
You mentioned that 2 weeks ago.
Yes, I did. I did it for the benefit of the rest of the people here. But I would like to play for you an 8-second clip from a meeting last Friday on the WHO. And this is Dr. Maria Van Kokov, I can't pronounce her name, Kokovand. But she said the following, and this is very important to hear what she said. It's only 8 seconds. Listen carefully.
From the data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a secondary individual.
I'll play it again, so for your benefit. This is important that you...
From the data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a secondary individual.
It still seems to be rare. In other words, it remains to be rare that an asymptomatic person will transmit to another individual. She's saying it's rare to transmit the COVID-19 to another individual. It does happen. COVID-19 is real. But the numbers are showing, and according to the CDC, and I don't know, if you have that letter in front of you, that's fine. You can pull those numbers up right now. What it relates to is for every 3,300 people, only 1.3 persons will die from it, or excuse me, be infected from it. The numbers of death are even lower. Now, when you try to put this information out, and by the way, that clip I posted on Facebook, it's been taken down and declared as false information. This is the WHO. We're talking major censorship here. We're talking officials making official statements, and they're being censored. Now, that's not the only thing. This issue about being forced to wear a face mask, I want to point out that apartment to the...
If you're here to speak to item 6A, then you need to wait until I call that public hearing, Dave, if you don't mind.
What's that?
If you're here to speak regarding the resolution regarding face mask wearing,
yes,
please wait until I call that public hearing, and then you'll be given an opportunity to comment.
Okay. I only wanted to point out that information and documents that back up what I'm saying, this is an official government record, this is a congressional record. It comes from the US.gov website,
Andy?
and you post it, and it's deemed as false information. We're being censored. It's easier to fool people than it is to convince them they've been fooled. Thank you.
Other communications from the public tonight? Further comments? Not seeing any. We'll stay with the audience. Any volunteer board reports from the audience tonight? How about the council? Not seeing any. We'll move on to item 5, which is our consent agenda. Any changes or additions to the June 15th, 2020 special session and regular session? Rebecca.
Yeah, Sorry, Michelle, I didn't send this to you. It is page 22, second sentence down. At the very end, it should read, "One of the best parts," just to add an S, "of a small town is feeling that enormous heart for those who are suffering." Otherwise, great, thank you.
Motion?
I'd like to
Please.
make a motion to accept the minutes with one correction for June 15th, 2020.
Is there a second to the motion adopting the consent agenda as amended?
I'll second.
Seconded by Councilor Hennen. Further discussion? All those in favor, please raise your hand. Those opposed, like sign, and that motion does carry unanimously. And just for the record, I neglected to mention that Steve Quinnell is absent and excused this evening, and we hope he's having a good river trip.
Oh, is that where you?
We'll move on to item 6A of our agenda, which will be resolution number 20-18, a resolution strongly encouraging the use of masks or other cloth face coverings in public settings to help prevent the spread of COVID-19, and this appears on page 282 of the packet. Angie, anything to add to your staff report? Okay. I'm going to go ahead and, for the public's benefit, it's lengthy, it's 4 pages, but for the public record and for those watching, they need to understand what we are actually contemplating here this evening, and it is the resolution I stated. Just for the record, Michelle, we did have 528 folks comment, written comments via email between July 1st and today at 4 p.m., which is when we established the cutoff date. We had about 350 in favor of the resolution mandating or suggesting the use of cloth masks, which is about 67% of those that responded. 200 against mandating, which is about a 30% response, and about 3% or about 15 respondees somewhere in the middle. So with that said, I am going to go ahead and read the resolution, and then we can take it up for debate on the floor of the council. So please bear with me. I think it's the longest thing I've ever had to read up here, so we'll just take a few minutes. Again, this will be resolution number 20-18, a resolution of the City Council of the City of Whitefish, Montana, strongly encouraging the use of masks or cloth face coverings in public settings to help prevent the spread of COVID-19. Whereas coronaviruses are a large family of virus that cause illness ranging from the common cold to more serious issues including death, and whereas in late 2019 an outbreak of a new strain of coronavirus began in Wuhan, China, and whereas on February 11th, 2020, the World Health Organization named the new strain of coronavirus causing illness in China COVID-19. And whereas according to the Center for Disease Control, COVID-19 is thought to spread mainly through close contact from person to person and respiratory droplets from someone who is infected. People who are infected often have symptoms of illness. Some people without symptoms may also spread the virus. And whereas the Center for Disease Control has warned the virus that causes COVID-19 is spreading very easily and sustainably between people. And whereas on March 11th, 2020, the World Health Organization declared a global pandemic due to the spread of COVID-19. And whereas President Donald Trump, Governor Steve Bullock, the Flathead County Board of Commissioners, and myself, Mayor John Mulfeld, have all declared states of emergency related to COVID-19. And whereas on March 16th and April 5th, 2020, the city adopted emergency ordinance numbers 20-04 and 20-05, enacting measures to reduce the spread of COVID-19. And whereas on March 27th, 2020, Governor Bullock issued a, quote, stay-at-home directive. And whereas on March 30th, 2020, Governor Bullock issued a directive requiring that individuals traveling to Montana from another state or country self-quarantine for 14 days. And whereas on or about April 3rd, 2020, the Center for Disease Control recommended that individuals wear masks or cloth face coverings in public settings, especially when other social distancing measures are difficult to maintain to prevent the spread of COVID-19. And whereas the city has been strongly committed to following all recommendations from the federal, state, and county levels and instituted measures such as requiring sheltering in place, supporting the closure of schools, closing City Hall to the public, closing some city parks and recreational facilities, allowing or requiring city employees to work from home, closing lodging facilities, developing methods for extensive public outreach, and discouraging travel to the region. It's page 1. And whereas the efforts of the state and the city were successful in helping limit the spread of COVID-19 within our community. And whereas on April 22nd, 2020, Governor Bullock issued a directive for, quote, reopening the Big Sky that provided for a phased reopening of Montana and addressed the guidelines for phase 1. And whereas Governor Bullock's April 23rd, 2020 directive set forth the following guidelines for every phase of this reopening. Individuals should continue to practice good hygiene by adhering to the following guidelines. Wash your hands with soap and water or use hand sanitizer, especially after touching frequently used items or surfaces. Avoid touching your face, sneeze or cough into a tissue or the inside of your elbow. Disinfect frequently and used items and surfaces as much as possible. Strongly consider using non-medical face coverings while in public, especially in circumstances that do not readily allow for appropriate physical distancing. People who feel sick should stay at home. Do not go to work or school. Contact and follow the advice of your medical provider. Follow local health department guidance on isolation and quarantine. Employers should develop and implement appropriate policies in accordance with federal, state, and local guidance and regulations, and informed by industry best practices regarding social distancing and protective equipment, temperature checks and or symptom screening, testing, isolating, and contact tracing in collaboration with public health authorities, sanitation, use and disinfection of common and high traffic areas, monitor workforce for indicative symptoms. Do not allow people with symptoms of COVID-19 to work. Collaborate with public health officials when implementing policies and procedures for workforce contact tracing following an employee's COVID-19 positive test result. Whereas on May 19th, 2020, Governor Bullock issued a directive moving the state into phase 2 of the reopening, which increased permissible group sizes to 50 individuals, provided social distancing can be accomplished, allowed all businesses to operate, provided they adhere to physical distancing, the phase 2 guidelines, all other directives and guidance remain in effect, and CDC sanitation protocols. Allowed restaurants, bars, breweries, distilleries, and casinos to remain in the same operational status as phase 1, but with an increase to 75% capacity. Allowed gyms, indoor group fitness classes, pools, and hot tubs to operate at 75% capacity if they adhere to strict physical distancing and exercise frequent sanitation protocols. Allowed concert halls, bowling alleys, and other places of assembly to operate with reduced capacity, provided they adhere to physical distancing guidelines and follow CDC sanitation protocols. Allowed child care facilities to increase capacity, consistent with the guidelines contained in the governor's previous directive on child care if physical distancing guidelines can be implemented, and removed the 24-person cap per facility effective on June 1st. Directed employers to continue to permit telework as much as possible and where feasible. Directed senior living or assisted living facilities and outdoor recreation to continue to follow the guidelines of phase 1. Whereas Governor Bullock's May 19th, 2020 directive also lifted the 14-day quarantine requirement for travelers from other states and countries effective June 1st, 2020. And whereas it is estimated that in 2018 alone, the city of Whitefish welcomed between 500,000 and 1.25 million visitors. And whereas Governor Bullock lifted the 14-day quarantine requirement for visitors from other states and countries, the city has experienced a significant influx of visitors, many of whom have traveled from areas with a high rate of COVID-19 infection. And whereas since phase 2 of the reopening, the state has experienced a marked increase in COVID-19 cases, with the highest number ever being reported on June 28th, 2020. And whereas since phase 2 of the reopening, Flathead County has experienced a marked increase in COVID-19 cases, with 20 new cases reported after 4 weeks of no new cases. And whereas on or about June 5th, 2020, the World Health Organization advised governments to encourage the general public to wear masks or cloth face coverings to help prevent the spread of COVID-19. And whereas strongly encouraging the use of masks or face coverings in public settings in accordance with federal and state guidance will help ensure the health and safety of the city's residents and visitors alike, will reduce the likelihood that the state will reinstate directives closing businesses, and will limit the cascading impact on critical services by limiting spread of COVID-19. Last page. And whereas it is in the best interest of the city of Whitefish and its inhabitants to strongly encourage residents and visitors to use masks or cloth face coverings in public to help reduce the spread of COVID-19. Now, therefore, be it resolved by the City Council of the City of Whitefish, Montana, and its inhabitants as follow. Section 1, all of the recitals set forth above are hereby adopted as findings of fact. Section 2, the following guidelines must be followed within the City of Whitefish and are strongly encouraged. All individuals should wear masks or cloth face coverings over their noses and mouths when indoors in public settings or commercial spaces outside the home. All individuals present in a city park or on a city sidewalk, shared use path, or right-of-way should wear masks or cloth face coverings. Employers should provide access to masks or cloth face coverings to employees present in the workplace and require employees to utilize them while at work. Businesses should recommend that patrons wear masks or face coverings and clearly post signs stating such recommendations. These guidelines do not apply to the following: children under the age of 6, individuals for whom a mask or cloth face covering would cause impairment due to an existing physical or mental condition, individuals working in a profession in which the use of a mask or face covering will not be compatible with the duties of the profession, individuals who do not have contact with the public and can maintain social distancing with other employees at all times, individuals exercising if a mask for face covering would interfere with their breathing, individuals who are seated at a restaurant or bar while eating or drinking. Section 3, if the City of Whitefish determines the above guidelines are not being adhered to, the city will consider passing an ordinance which will require that such guidelines be adhered to and provide penalties for non-compliance. Section 4, this resolution shall take effective immediately upon its adoption by the City Council and signing by myself, the Mayor. And we'll pass this ordinance if we give it consideration this evening. This evening it will go into effect immediately. I want to remind the public that we're asking our community to voluntarily wear masks. We met with over 20 businesses on Tuesday, a broad spectrum from this community, and all but one business strongly supported this city council enacting an emergency ordinance. And it was a good cross-section of this community. And we took this approach versus a ordinance, which is law, as I indicated. We decided to do a resolution because we believe that people in Whitefish will do the right thing voluntarily without being told what to do. So we're hopeful that this will resonate with folks and they'll comply with our request. With that said, I'll turn it back to the council for discussion or a motion.
Well, we're not going to do any public comment?
Excuse me, there is public comment. Yeah. We'll go ahead and open the public hearing. And please, just for the record, your name and address when you approach the council up at the podium. Any public comment tonight? Yeah, Dave, come back up.
Again, my name is Dave Von Kleist, 436B West 3rd Street, and I apologize for the confusion in the last presentation. I thought that was it. And I feel like I'm flying roller skates here for a moment. According to the Department of Justice, the DOJ ADA guidelines, people with a physical or emotional condition should not be required to wear any type of face mask, and if they are forced or coerced to do so, those guilty of that can be subjected to a $75,000 fine for the first offense and a $150,000 fine for every subsequent offense. I just want to put that out there in the beginning. In order to form an opinion or make a decision, you all need information. Now, if the information that you're being provided is misinformation or disinformation or a lie, then that means that the decision and opinions that you form are nothing more than extensions of those lies. The reason I mention that is because there's a lot of fake news out there. There's a lot of misinformation. We all hear about it on Facebook and YouTube, et cetera, et cetera. As I've already mentioned, I think I have a pretty good track record for being able to stick to documentation and have been in this for quite some time. And I just want to flip through a few pages. These are congressional records. The first one is entitled Biological Testing Involving Human Subjects by the Department of Defense, 1977. I'm not going to get into the details, but it discusses how offensive biological weapons were released to the public in Pennsylvania, in the tunnel system, in New York, in the subway system, and off the coast of San Francisco, and they tracked how many people got sick. Another document is called Human Drug Testing by the CIA. And these are all drugs that were given to the American people without their knowledge or consent. They have been experimenting on you. Now, you can roll your eyes and say I'm a conspiracy theorist if you want. You have to argue with the documents. Talk to the hand. There's another document here, and this one is kind of interesting. You might think of X-Files when you hear the title. It's called MK Ultra, the CIA's program of research in behavioral modification. The reason I brought this one up is because in this document, it discusses how you change behavior of a general population by forcing a particular habit upon them. And if that habit is forced upon them for more than 12 weeks, it becomes permanent. Now that means if we are all forced to go into frantic hand washing, social distancing, staying at home and wearing masks, and it's already been more than 12 weeks, it's becoming the new norm. Sorry, no more handshakes, no more hugs for you, no more hanging out with your friends. Is this what you really want? The point is that the information that you've been being provided is misinformation. It's coming from people that have an agenda. And I want to remind you that a disease, a virus, a bacteria is nonpartisan. It doesn't care if you're liberal or conservative or Republican or Democrat or right or left or red or blue. We're dealing with, yes, a real virus. And the point is that just like physical activity, if you stop exercising, your muscles will atrophy and eventually become very weak. Such is the case with your immune system. If you place yourself in a sterile environment for a period of time, your immune system goes away. We have something called herd immunity. We're exposed to bacteria and viruses every day of our lives, and that's what keeps us strong. By isolating ourselves, we make ourselves weaker. Now, these are facts, and a lot of it's just common sense. You don't have to look this stuff up. But I am begging you, I implore you to consider what I'm saying here. And again, this is not partisan. It's not because if I'm a Republican or Democrat, this got nothing to do with it. But unfortunately, this entire COVID-19 has been turned into a huge political football. Now, if your decisions are being made because of some political or financial gain, well, then you're not really representing the interests of the people. Now, these are all considerations that I would implore, I beg you to take into mind. And I have a good idea where Governor Bullock is coming from. And yes, it's a bit political on his side. And I don't mean to say that in criticism, it's just a fact of life. So I will leave you with that. And I will again say, it's easier to fool people than it is to convince them you've been fooled. And I am telling you, from the bottom of my heart, with all sincerity, and I know what I'm talking about, America has been manipulated, and we're continually being manipulated. The agenda, well, we could probably get to that sometime in the future. But you'll be able to figure this out. Think outside of the cage. And I will tell you that if this ordinance is passed, I will not be wearing a mask, and if I am forced to do so, I will utilize the Department of Justice ADA guidelines.
Just a reminder, this is a resolution.
Yeah,
not law.
I understand that. I understand. But I'm just saying, I'm trying to put this out here so that you can make an informed decision. Look these documents up. Oh, and by the way, I tried to post this on Facebook. It violated community standards. Go figure. You can't post a government congressional record without censorship. And the clip that I played just a little while ago, they've taken that down, claiming it's false information. That's an official statement from an official from the WHO, and they're saying it's false information. I am mourning the death of our country only 2 days after we celebrated its birthday. I'm dead serious. I've been screaming about this for 25 years. People didn't listen then, and I got a funny feeling people are rolling their eyes and are not listening now. God help us all if we don't open our eyes and pay attention to what's going on. There is an agenda. Thank you for your time.
Thanks, Dave. I do have a sign-up list for folks that signed up to comment on Resolution 20-18. I don't need to read the list necessarily. If you did sign up, please approach the podium and just name and address and provide your comments, please.
So I'm Len Bennett. I live at 750 Northwoods Drive. And I want to thank you for providing the clean mask at the door. I feel like if businesses are required to do this, that the city should maybe provide this instead of bandanas. So I know everybody's been afraid and you've had to deal with so much with this new virus. And it's just been frightening to everyone across the board. So we hear so much about safety, and I can tell you I was so scared and thinking we need to shut down and be safe. But then we know that the fatality rate is not what we thought it would be. So now I'm, just thinking, is this a precedent we want to set forever? That if we always have a virus with a case fatality rate of less than 1%, if I'm right, I don't know the case fatality rate. 0.002. Okay. So if that rate is lower than the flu, we also have so many other diseases like tuberculosis or other viruses. Are we going to, wear this for the rest of our lives as a precedent? So to enforce it as some sort of mandate to me, I'm like, wait, can we back up? Can we put more sinks in? Can we keep the bathrooms clean? I tend to be germ-phobic, and I'm a nurse, and I have a 4-year Bachelor of Science degree. So you could call me a weirdo. I'm a little germ-phobic all the time. Like, I'm always like, oh, why are there not more places to wash our hands at, like during Winter Carnival? It's jam-packed with people from all over. The bathrooms everywhere are just disgusting. There's no place to wash your hands. So that might be my 3 minutes, but I guess I agree if you're immune compromised and you're afraid of getting sick, you should maybe, I don't know the exact answer. Keep your distance, wear a mask, or avoid crowded places. Don't go to Winter Carnival, don't go to a crowded restaurant, but I don't think we should shut down the whole community or require people to wear a mask, like let people use their own logic and common sense. Some people can't wear a mask. I would assume maybe firemen who have lung damage. Many people don't want to admit to you the reason they don't want to wear a mask. They need the oxygen in their bodies to keep their immune system up. And I feel like that's just actually a horrible thing to be forcing people to wear a mask. In hot weather, who are struggling and they're trying to obey some rules so they make everyone happy, but I think it's an unfair rule to expect everyone to wear a mask for something with this low of a case fatality rate. But I do say thank you so much for all you've done in this horrible thing that was very frightening. So thanks.
Thanks, Len. Who's next? I would just ask, please, out of respect for chambers, no clapping, cheering, booing, what have you, please.
Well, first I want to say thank you to everyone here today for being so respectful and listening to what I have to say. Please know I can see both perspectives.
Name and address, please.
Oh, I'm so sorry.
It's all right, it's all right.
I'm Nicole Hale. My address is 422 Ice House Terrace. And as I was saying, I can see both perspectives on the mask issue. As a person who has a compromised immune system, and with parents who have health issues, I can understand the fear that is permeating our society today. I'm not proclaiming to be a doctor, and I'm not pretending to be an expert. However, at this point, even the experts have conflicting reports. I do know a little bit about biology from my university days, and being a mom, I know that germs are healthy. Every pathologist would agree that our bodies need to be exposed to viruses and bacteria in order to strengthen our immune systems. If we live in a sanitized environment for too long, just like other people were saying, our bodies will become weak. And then when we reintroduce bacteria and viruses, our bodies will have a difficult time combating any disease or illness. We can all agree no one is immune to COVID-19. Unfortunately, we are all going to get it. It is so widespread that it's just a matter of time. By enforcing masks, are we just delaying the inevitable? Are masks going to eradicate COVID-19? I'm afraid not. Will we all die from COVID-19? No. We have, like people have said, my references are 0.04 to 0.4% chance. Will we be creating a bigger nightmare, possibly even more deaths and overpopulated hospitals for next fall when the regular cold flu season hits? Probably so. However, I believe everyone has the right to choose to wear or not wear a mask. If you feel more comfortable, then wear one. But should we enforce this as a law when we already know everyone is eventually going to get it? It is too widespread to stop it at this point. And who is going to enforce this mandate? This year, our police departments throughout the country have been attacked and devalued. They already have a tough job. Do we really expect them to add mass patrol to their already lengthy duties? I also believe businesses have the right to deny service to anyone that doesn't want to wear a mask. If someone wants to shop or dine in your store, then it's your rules. Kind of like the no shirt, no service policy. If I choose not to follow your rules, then I have made my decision. I just basically had one question when it came to the last page of that. It was section 2 on the last page, and it said that it says you must, thank you for doing that. The following guidelines must be followed within the city of Whitefish. So that the must is where it's throwing me off. And then the next bullet point is all individuals should wear masks. Or, so is it must or is it should? I'm a little bit confused on that one. And then the second bullet point also is, are we really gonna enforce people outside in city parks and on my sidewalk? I'm gonna have to wear a mask when I'm walking my dog by myself. So those are just a few of my questions, and I hope what I had to say was worth your time and had some weight to making your decision. I don't value your jobs. You have really tough jobs, and I can see here today, so I appreciate your time.
Thanks, Nicole. Appreciate the comments. Who's next?
My name is Constance C., and my address is P.O. Box 331, Whitefish. I'd like to start by recognizing that our mayor will wear his mask on or off. And what I have researched has shown that cloth masks, like most of the people wear, are ineffective. And I have research to prove that from the World Health Organization, for one. I believe that we need to table this decision at this juncture. And the reason I believe it's urgent that we table this is that it's the 4th of July. It's the week where we are busiest in Whitefish. You had over 500 replies so far about this. Was it 500 and how many, please?
528.
520?
528.
528. See, I can't even hear you when you have your mask on. I can't understand. So 528 responses. Have you all read all 528? And if they referenced a scientific journal, did you look at that scientific journal? My response came in at 4 minutes till 4, and the deadline was 4. So I cannot believe that all 528 of these letters that are very important to those who wrote it have been read. The other question I have is, why should we in the city of Whitefish change our rules and regulations because someone visited here from New York Great Falls, or Texas? Because originally the letters that I read that were counter in favor of mandating masks were from Great Falls, Missoula, Texas, when it's my life that's being affected if I'm here 5, 6, 7, 8 days a week. So I would like to suggest we postpone it. You said, sir, you spoke to 20 businesses. Is that correct?
This isn't an opportunity for question and answer. Just please
Well, what
state
I'd
your
like to
public
state
comment.
is that I talked to 15. And of the 15 that I spoke with, they were angry. And I spoke to them on July 3rd, 4th, and 5th. And the reason they were angry was this hit them like a ton of bricks out of nowhere, this mandatory mask requirement, and opening the door for fines. So they were upset they were not told about it ahead of time. And I think that to plan a vote or to open the doors to public on the busiest week of the year when our businesses can't be here, the employees can't be here. Many individuals have families they're entertaining. Others are out of town, out of state, visiting family. You picked a time that I think was planned so that we would not have full attendance. And there is no reason to not postpone the date on this vote until more individuals can attend of that 528. Just basically, I want to tell 3 quick stories. I have spoken with a middle-aged high school teacher who had a 7th grade student in June who was so scared by the isolation that she was suicidal. And the mask is what could push her right over the edge. She is now seeking counseling. Then I spoke to a very strong senior friend of mine in her 70s. She just bought a gun. She's in her late 70s, her first gun. Why? She's working on her concealed carry permit. She is adamant against masks. Too many strangers around town wearing masks. They frighten this lady, especially when she lives alone and she's a petite, frail soul. Mind you, this invincible woman has lived through rape as a child, spousal abuse as a young woman, and cancer as an adult, but she's afraid of these mandated masks that are frightening her. Third person, a friend in her 40s who's deaf, Diana. She reads Lips to Survive. People wearing masks prevent her from communicating. She's frustrated. She's angry at this situation. She's getting ready to move out of town. She can't speak. She can't hear because you have closed off that door for her with your mask. I have 4 pages of research that shows that masks, especially the kind that we're wearing here, are not fitted properly. Therefore, lots of things can go in and out of the sides and above your bridge of your nose. Please consider postponing this critical decision until a time when more businesses and more of those 528 individuals have the opportunity to attend.
Who's next?
My name is Stacy Magoo. I live at 255 Vista Drive. I'm a business owner. I was not approached. Nobody approached. I found out about this, I believe, yesterday or the day before. Not really enough time to read it or go over, but once I did, I was infuriated. I'm surprised that there are as many that are in favor of it. They must not realize that this town is supported by tourism. Our sales alone, 75% of our sales are tourists. That means the resort tax we pay as a business to this town, 75% is from tourism. The donations we made to this community last year was over $70,000. That's just one business, and 75% of that money came from tourism. I will welcome anybody into my store with or without a mask. I feel that inviting somebody into my store is like inviting them into my home. They are welcome no matter what. If they don't want to come, they don't have to come. If they want to come wearing their mask, they can wear their mask. I'm not going to enforce it. I personally am so against it. I will not walk into a store that says mask required, and I expect that most of the people that walk by my store will keep walking if they see a very rude sign like that posted. I noticed before Constance spoke that you, Mayor Muehlfeld, had been fidgeting with your mask the entire time. I cannot have a sale or communicate with a customer with a mask on. We sometimes visit with, say, example, engagement ring customers for an hour, hour and a half. I am hard of hearing. I can't read lips. It's hard. It's very difficult to communicate. There are 5 employees in my store. 4 of them feel the same way I do. I'm forced to wear a mask. I get migraine headaches. But it goes back to how rude it is. I have begged the city. I sent an email to the city manager during our shutdown, 5-week shutdown, which I felt was a little, back to my feelings, a little long and unneeded, and I asked that she sit with a face of the community that owns a business that were most affected by the shutdown. No response. So, I don't know, that's my point. I agree, this is a terrible time to enforce this when we have our guests here. My other question would be about the increased cases here in the Flathead Valley. I am now able to drive down to the high school and get a test. I wasn't able to do that a month ago, 2 months ago. Even if I had a few symptoms a couple months ago, I wasn't allowed to have a test. And then it opened up more and more. Is that the reason we have more cases in our valley? Yes. Thank you.
Who's next?
My name is Catherine Owens, and I live at 329 Shady River Lane. I think you heard from several people here that the data doesn't support masks, that it'll hurt businesses, it will destroy this community. You want a divisive community between the maskers and the non-maskers? So when I walk down the street and I'm not wearing my mask because I don't hold you responsible for the air that I breathe, then I will be determined a careless person. But yet, I don't hold you responsible. It's not about me being careless about you. It's me knowing I am a healthy person, you are a healthy person, and I trust that if you're not, whether it's the flu, whether it's the common cold, whether it's whatever it is, that you'll stay home. I don't expect anybody to ever wear a mask, but that you'll take precautions if you have some kind of illness. But this mandated mask wearing is craziness. And you reiterated that this is not an ordinance, that this is just a mandate. So we should feel really privileged, I guess, that this was just a mandate, because you could have made it an ordinance. That's kind of how I heard that you guys are really lucky that we only just made this a mandate. So I think, and I know I sound really snarky, and I'm sorry, I did not intend to feel this way or to speak like this, and I'm sorry, but you're going to create divisiveness in this beautiful, lovely, extraordinary town. From those who wear it to those that not. I don't care if you wear a mask, go ahead. But I don't think the maskers feel the same about us. I think they say, oh, that person is so careless. I've had it with my girls. People roll their eyes. Ugh, can't believe she's coming in here without a mask. It's going to be like neighbor against neighbor. This is not what we want in this town. And lastly, besides the data not even being there, lastly, I want to ask, it's a rhetorical question, you don't have to answer. How many of you behind the scenes when we walk out, are you actually in your offices wearing masks? I mean, when you're kind of hanging out together, are you actually wearing masks? And will you really take our comments to heart? Is this a formality? Have you made your decisions already? Because I almost feel like, especially with all the masks, that this decision has been made. And I really pray that you will listen and hear us and really consider how this is going to affect, I mean, literally change the face of this town. Thank you.
Thanks for the comments. Who's next?
Oh, I'm sorry.
Just a reminder too, we do have a long meeting. If we could keep comments to 3 minutes, I would certainly appreciate it.
My name is Gerlinda Waters. I've been in this community for 40 years. Andy Fury knows me some time ago. I'm also a businesswoman. I own 2 businesses. One of them is a storage facility in the valley. I move a lot of people in from different areas. So I can tell you a couple stories of that, but I'm not going to get into any lengthy conversation on that. What I would like to go ahead and ask is a couple questions, not to be answered, but for pondering. One question that, I do appreciate the fact that you are not trying to, you're just making it a mandate and you're asking people to voluntarily do that. The one question that I guess that I have is on what scientific fact are you basing this decision on? I think this is a very important question. What facts are you basing it on? Because you are asking an entire community to go ahead and wear this, and really from what I'm hearing is there were a few business people that wanted it. One business person was excluded, and she's speaking up very strongly. And so I have a feeling that I think this was not a true, apparently a really very fair inquiry to the business people. Then also, we are talking about, I think something that we need to remember is that we were supposed to be flattening the curve. We weren't supposed to eradicate the virus. And I would like to go ahead and do a side mention. I was born and raised in Austria. I was there during COVID-19. My mother had an emergency surgery, and I'm Austrian, and that's where I was there in March. I saw it all. And actually what I saw was not really representing what we're told here in this country. So aside from that too, they have done very well over there. Schools are open. Everything is good to go. And that is I'm in communication with my family 3 times a week, just to go ahead and let people know where this supposedly is going. Also, I would like to go ahead and just mention to you, I personally have serious problems wearing a mask. I have some problems with my upper respiratory system, and if I wear it for a longer period of time, then I start developing some problems, mainly because you're breathing in your carbon dioxide. And that is very severe for your, for your breathing, and eventually affects your brain. So after a while, I get hyperventilating, and so I don't know what you would do with me. Are you going to penalize me? And that brings me also to the next question is are you prepared to enforce it? And who is going to enforce it? Are you really wanting our police department, which we love, we've got great relationship with our police department, do you want to really put them in a position to enforce this? And eventually it could be enforced. I realize right now it's a mandate, but if you're going to, a resolution, I guess if you're going to pass it, if it becomes more severe. And last, not lastly, but next to last, I'd like you to know, I was shocked. I do not know if your figures are correct. If you have a large amount of people from other areas writing to our city here, to go ahead and complain and wanting us to wear masks, this city council needs to reconsider things. Because this is the city of Whitefish. We are citizens of Whitefish. And I believe that other people from Great Falls, Missoula, who knows where, should not dictate to our city council this is with respect to you, because you're representing us. We should be able to be the ones that you want to listen to and hear, and not people from Great Falls, Missoula. And I guess I was in shock because I did not know that maybe some of these people, or a large amount of people, came from that. But I don't know that for certain, sir, so I'm not trying to ask a question. I know I'm not allowed to.
Just with all due respect, you're well over 4.5 minutes, and we're just
Okay.
trying to keep comments to 3.
Okay, that's fine. Anyway, thank you for your time, and I guess I would say that it would be really right to reconsider maybe your decision.
Thanks very much for the comments. Who's next?
My name is Kevin Reed. I was born Flathead Valley, lived here my entire life. The mask policy, they've already given you the numbers. I don't need to repeat it. 0.0002% mortality rate. I mean, the absurdity and the hypocrisy of it is asinine. We've seen the media and where they're coming from. Riots and everything seem to not spread COVID, but somehow Trump rallies do. Can we really rely on these people for our medical information? We have people like Dr. Fauci, who you have seemed to ordain the mighty be-all World Health Organization representative, saying just 2 months ago this.
With masks. You're sure of it, because people are listening really closely to this. Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often, there are unintended consequences. People keep fiddling with the mask, and they keep touching their face. And can you get some schmutz sort of staying inside there? Of course. But when you think masks, you should think of healthcare providers needing them and people who are ill.
That is the head of the World Health Organization laughing at the fact that people should be wearing masks in the middle of a viral pandemic. Of course, a couple months later, he changes his mind. There's lots of money involved in all this. People are profiting. It's absurd that people are even taking this seriously. We have doctors like one of the top 50 doctors in the world, Dr. Rashid Buttar, who has constantly spoke out against wearing the mask, citing that you restrict oxygen, increase carbon monoxide intake, condensation in your breath breaks down the polypropylene inside of masks, components of face masks, which will cause you to breathe in those toxic components, which will cause histotoxic, hypoxic injury. When you become hypoxic, the increase of cortisol levels, which then course through the body, go into a fight or flight state, which suppresses your immune system, then becomes susceptible to any bacteria or pathogen by wearing a mask. The senator of Minnesota is a doctor, Dr. Scott Jensen. He is being persecuted. He was also the 2015 Minnesota Doctor of the Year and had been accused and investigated for comparing COVID-19 to the flu. We have Elmhurst Hospital, who was infiltrated by an Army veteran nurse. Her name is Erin Marie Olszewski. She has an hour and 19 documentary. She has a book out. She has proven that the hotbed of this virus was because that patients were purposely put into rooms. They were diagnosed as COVID negative, but were being treated for COVID. Everything is on tape, and she has been criticized because ethically she violated the patient's right to privacy by going in with a hidden camera and exposing this. So shame on her. It's not about the information, it's about what she exposed and how wrong she was for proving that these hospitals not only infected patients on purpose, but that they took COVID patients and purposely put them in rooms with non-COVID patients. It's all on video. Then she went down with other nurses inside there and said, hey, what's going on here? These patients were not, they were COVID negative. Why are they being treated for COVID? And everyone's like, boy, I don't know. I mean, the evidence at this point is beyond substantiating. If anybody watched Rand Paul on the congressional floor 2 days ago, drill Dr. Fauci, and Rand Paul is a doctor as well. He showed that Brown University shows that there are case studies of over 25,000 children in daycare. There was a 0.16% contracted COVID. 22 countries have reopened their schools and show no discernible increases in the cases of COVID. There have been contact tracing studies in 5 countries that couldn't show one single case of child to adult infection. The American Academy of Pediatrics says that we need to put our children back in schools. They are not likely to contract or spread COVID. The WHO has blackballed the nurse, one of their own scientists who put out the study that, and I will even add to it real quickly, 455 controlled people, 30 asymptomatic patients. She said transmission was rare. He was actually wrong. Transmission was 0. There wasn't one single transmission amongst 455 people.
Who's next?
Hi, my name is Carolyn Wright, and I live at 810 Patton Lane. And I would like to start off with that I agree with the previous speaker that we should table this resolution until you can meet with a good cross-section of the business owners, not just the business owners that had called or emailed complaining that people weren't wearing masks. I also would like to point out that the increase in cases that we're seeing in Montana is because we've had over 800% increase in testing. But that's not taking into account that our death rate has gone down just like it has across the nation, as well as hospitalizations. I also would like to say that in under 48 hours since we learned of the resolution 20 on July 4th, which we were quite shocked to find out about it on a holiday weekend and with such short notice that a decision was going to be made. We gathered over 400 signatures and over 168 comments against a mask requirement in Whitefish. These are some of the comments that we received. As a business owner in Whitefish, I reject the idea to infringe upon people's right to determine their own health and safety standards. I'm against any ordinance that requires or recommends people wear masks or other health decisions that belong solely to each individual. Here's another local business owner. I'm concerned about my staff having to wear masks for a full 8-hour shift. Several studies have shown the risk of breathing in your own CO2, which lowers immunity and causes lightheadedness, headaches, vertigo, and fatigue. Hospitalizations are down, deaths are down. Let those who desire protect themselves. It's not the government's job. And this, from the New England Journal of Medicine, May 21st, 2020. We know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID-19 as face-to-face contact within 6 feet with a patient with symptomatic COVID-19 that is sustained for at least a few minutes, and some say more than 10 minutes or even 30 minutes. The chance of catching COVID-19 from a passing interaction in a public space is therefore minimal. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic. And the Center for Infectious Disease Research and Policy, April 2020, we do not recommend requiring the general public who do not have symptoms of COVID-19-like illness to routinely wear cloth or surgical masks, because there is no scientific evidence that they are effective in reducing the risk of SARS-CoV-2 transmission. Their use may result in those wearing the mask to relax other distancing efforts because they have a sense of protection. Masks may confuse that message and give people a false sense of security. If masks had been a solution in Asia, which they were widely used, shouldn't they have stopped the pandemic before it spread elsewhere? And there's actually a really easy solution, dilemma, win-win. It's a win-win solution, for this problem that a company, it's called airdoctorpro.com, has actually developed a mask, and it has a KN95 lab-tested rating with HEPA filtration that actually protects the wearer. So if someone is concerned about picking up this virus, they can protect themselves without demanding that everyone else wears that. So thank you for your time.
Thanks very much for your comments.
Hi, I'm Bonnie Clausen. I live at 1105 O'Brien Avenue. And I was wondering if we'd say the pledge. I figured we would. And what stuck out was justice for all. And I believe we all live by our own faith. And I have my own faith. You all have yours. You try to live by it. But this is why I believe what I believe. And I think I have to adhere to it. It's from Psalm 139:12 from the Bible. It says, "For you created my inmost being. You knit me together in my mother's womb. I praise you because I am fearfully and wonderfully made. Your works are wonderful. I know that full well. My frame was not hidden from you. When I was woven together in the depths of the earth, your eyes saw my unformed body. All the days ordained, I'm going to repeat that, for me were written in your book before one of them came to be." So I believe for myself, I put a mask on to go to Costco. It's the only place I've had a mask on. I took my 7-year-old granddaughter. She said, "Grandma, I can't breathe." I was getting short of breath. I was only in there a half hour. I talked to 8 people today. I've gone out for 4 months. I go out in the streets and I talk to people and I'll say, "What do you think about COVID?" And we have big discussions. And I would say for 4 months I've gone out on the streets. People are very anxious to talk. And you would be surprised, about 75% of them think this is an evil regime. I was surprised because they're all strangers. They don't trust it. They feel like they're being groomed for something worse. So they're actually afraid. But as a Christian, we are persecuted sometimes, and I gear up for that, but it does feel like an agenda. One thing that my daughter-in-law's cousin lives in California. Is this what we really want? It's a private school, very expensive. They decided not to send their 3 kids. It would be $90,000. But what they're going to do is make a 6-foot circle around a desk, and the child cannot leave that space. They can't go to recess. And what I'm saying is, I feel like it's child abuse to put masks on children, to make them not want to hug. And I've listened to other specialists all over the world. They think immunity is built for children and adults by exchanging things. Dr. Shiva thinks we have trillions of viruses that masks can actually bring it up and give you a disease. So there's other evidence, but I just want to say that if you are, I like what Carol Ann said, if you're scared, wear a mask. And I don't care if you all wear masks, but I want to breathe the air that God gave me. And I have one little story. I'll be really quick. My handicapped sister has kidney failure. She was told she would die the next day. She was in the hospital, spent 2 years. She's mentally handicapped. I take care of her. I have a 93-year-old mother in my house that sees lots of people. Her immunity is better than all of yours, I bet. And my sister was supposed to die. She would not go on dialysis. I let her make that decision, and they're all amazed. And that's why I emphasized all the days ordained for me were written in your book before one of them came to be. I think we die, my dad died in an accident. I've lost a lot of people. You can die tripping. I think we die when God wants us to. So let us live our lives, and people can protect themselves, and that's okay. But people do get mad at you if you don't wear a mask. But I don't get mad if people wear a mask. So, whatever.
Thanks, Bonnie.
Hi, I'm Julie Perchy. I live at 350 Missy Lane in Whitefish. I just wanted to read my letter that I sent in. I wasn't sure, I did not get a response. So I'm not sure if you guys received it or not. So, please vote no on this resolution. It is not in the best interests of our community and society. If resolution number 20 passes, it will cause a division in our city, pitting neighbor against neighbor. You have created an echo chamber, and you are not representing all of your constituents, but the select few that you surround yourself with. By using curried responses from select business owners, you ignore most of your constituents. Many of the citizens of Whitefish aren't being heard or represented. Science and facts do not support healthy people wearing a mask to protect others in public settings. There are reports of healthy young adults becoming sick with pleurisy from wearing a mask. If you have a compromised immune system, you should take precautions to protect yourself. You should not rely on others for your health. As reported in the New England Journal of Medicine on May 21st, 2020, wearing a mask does not offer protection from infection. Issuing a mandate for everyone to wear a mask is akin to the action of a ruling government, a monarchy. We decided against that rule almost 250 years ago. Do not pass this resolution. It is not in the best interest of the city. Thank you.
Who's next? Please don't hesitate.
Hello, I'm Alonso Conrad, 121 Westview Drive. Thank you for meeting with us tonight and for hosting this meeting for town input. It's a difficult job, I understand, and I appreciate your patience while we work through all of our comments regarding this event. Specifically, let's see, sorry, I'm a little nervous because I am a dissenting opinion tonight. I'm a dissenting opinion tonight. Thank you very much for allowing me to speak, for those of you who obviously can hear me. Anyway, so I believe it is within the authority of the Whitefish City Council and its moral obligation to enforce this resolution. If we look back on the outside of our city right now, there is a mandate that there is a ban on cell phone usage while driving a car. This policy was enacted in 2011 with the understanding there was a correlation between car usage and car driving and cell phone usage, which would increase accidents. For the safety of the residents of Whitefish, it was decided upon to enforce that policy and make a ban. There was some kickback, absolutely, I remember. I had just graduated high school, and I was not a fan of the ban. But in the end, we moved past that. And we have been, hopefully, I would like to think, have safer roads because of it. I believe that by passing this resolution, you are demonstrating leadership and guidance during a time of crisis, which will help protect the residents of this community. Today, the nation and the world is in an epidemic crisis. Either it's all a conspiracy together, or there is a crisis. Thankfully, there's not much dissension on that today. And Whitefish today is in the midst of its summer tourist season, which is essential to the business communities at large and for the welfare of the community. It is unfortunate they must be joined together, but they have been. The people who serve in the city, on the national parks, and the mountain resort meet with dozens to hundreds of people every day. They are exposed to the potential of asymptomatic carrying, and I believe that by passing this resolution, you grant protections to them and encourage businesses to protect their employees. The CDC the WHO, and Vice President Mike Pence of the Coronavirus Task Force all agree that mask wearing is not dangerous for general use. They also agree that wearing a mask will slow or prevent the spread of the virus effectively. We have heard quotes taken from people from WHO. We've heard ideas about 0.002, 3 zeros, was it? I'm sorry. Anyway, 0.0002% of the population of potential mortality from this virus, and I am not here to argue about the science today, unfortunately. I am here to say, though, that these heads of state and heads of organization have all agreed that these are safe measures to take into place, and they are effective. Today, I ask you to commit to the mask resolution in order to support your residents, embolden businesses to protect their employees and make policies to do so, to support and to prevent an economic downturn should we have a surge in cases beyond the 17 that are currently ongoing and pending any resolution for the Flathead Valley. To not act is to leave it unsupported and undetermined, the waters gray and unclear. It leaves your residents, those of us serving the community in front desk territories, on the mountain, at the beaches, vulnerable and at risk. To paraphrase Mike Pence's COVID-19 panel address 2 weeks ago in Dallas, now is the time to metaphorically put our arms around and protect the most vulnerable among us. Thank you very much for your time, and I appreciate having the moment to speak tonight.
Thank you, Alonzo.
My name is Ted Valentiner. I live at 305 Buckhorn Road. I need these to read. I have a question. First of all, not a question, I have a statement. The resolution is very open-ended. How long is this, if this is put into place, how long is this supposed to last? You realize that we're here talking about 1%. 100,000 people have been tested in Montana, 1,100 positive cases, many of those as a result of additional testing. I don't even understand why we're here. That's ridiculous. We have, what will be the criteria?
If folks don't stop clapping, I'm going to call a recess, and we're going to take about a 20-minute recess and then come back. So please have some respect. I've asked 3 times now. Sir, I apologize.
I remember in here it says if this doesn't work, you will decide that it will become a regulation. On what authority and on what criteria? That's completely open-ended. How long is this going to be put into effect? What criteria are you going to go by to say, no, we've decided you're all going to wear a mask and you're going to be fined if you're not? I don't believe that that's been addressed. That's open-ended, and I think it's inaccurate. Thank you.
Thanks, Ted. Who's next?
Hi, can you hear me? Okay, I'm Dr. Vita Wright. I am not a medical doctor. I'm a doctor with a PhD, and my research was understanding influences to the use of science and the link between intent, human behavior, and decision making. And so I was actually at home watching this live, and I saw the first speaker talk about the WHO misinformation, please respect me, that came out. The reason that I call it misinformation and that I felt compelled to come down here tonight is because 3 days ago, there was a letter by 239 scientists, signed it, including many scientists from around the world who work with the WHO, and they were expressing concern about the WHO being too conservative and too hesitant to be bold in acknowledging that aerosols are currently thought to be the primary way that people get COVID-19. And so that means us talking to each other for long enough within an airspace. Actually, if COVID is here, I would be surprised if there weren't some cases that came out of this meeting. I'm very concerned about it. I'm concerned about standing right here in front of this microphone where so many people have been speaking without masks. That said, I felt strongly enough that you needed to hear what some of the scientists are saying to drive down here. I left my son home alone. He's old enough to do that, but it was just very important to me. One of the things that stands out to me recently, so part of my concern also is all the out-of-state plates in the area right now. A lot of them are from hotspots, and we've had an increase of cases both in Montana. Flathead Valley is either the fourth, or Flathead County is either the fourth or fifth highest county in the state with the number of cases right now. I heard something said, we talk about the science, I heard something said earlier, there actually have been a lot of references to the death rate. The scientists tell us there's a 5-week lag from the time that the COVID starts spreading around a community until you start seeing those deaths. Because there's a lag from when you get exposed to when you start showing symptoms. It's another week until you get sick enough to be hospitalized, and another week until death. I'm not saying everybody's gonna die. We know that a lot of people don't die, but a lot of people do. One of the things too that makes me feel passionate about this is I'm watching places like Florida, Texas, Arizona. Those are places that ignored the fact that coronavirus is real. Arizona was the last to close and the first to open. And now their hospitals are at 90% capacity. We recognize that this coronavirus will be with us for a long time, but we haven't given enough time for the doctors to figure out treatment, vaccine, and most of all, it's important to slow the rate of transmission so that our healthcare system can take care of us. And whether they're taking care of us because we got in a car wreck, or whether they're taking care of us because of coronavirus. This is real. We're lucky here in Montana. We had the lowest rate of spread in the whole country. So it's easy to feel like it's not a big deal. Like we can be social, we can ignore it, and we're not gonna get it. But that's changing right now, and I'm very concerned about it. And I'm especially concerned in how Whitefish has changed over the past several weeks since Glacier National Park opened. It's just so busy downtown, and hardly anybody is acknowledging the concern and wearing a mask. And when you do go into places where people are wearing masks, they're playing with them all the time, they're wearing them below their nose, which the CDC is not the proper way to wear a mask. So I do even think, even if you don't adopt this resolution, I think it's important to do some education with the businesses that are choosing to wear masks. One of the things, again, when we talk about the science, is that the economists are saying, you can open up, but the business isn't gonna be there and the economy's not gonna improve long-term until people feel safe enough to go out and spend money. And the more people that end up getting sick, the less safe that people are gonna be. So there are some things we can do. Again, even if you don't adopt the resolution, I'm concerned about farmers market. I think you can look at some other towns around the West, tourist towns, whether it's mask, whether it's one-way flow. I think there's more that we can do with the market and the art show and some things like that. ER doctors in other parts of the country, in New York in particular, are pleading with us to take this seriously. They're on the front lines. They are seeing what this does to people. Not only is death a concern for a percentage of the population, there are also about 4,000 people now that have had coronavirus in this country that have long-term effects. They're not healing very quickly. It's not like the flu or the common cold. I think we'll get there. We'll get a vaccine, we'll figure out how to treat it, but we're not there yet, which is why it's important to adopt a resolution like this right now in the front end. Just for an example, I know there's been some discussion around, sorry, am I up? Okay, couple of final points. There's been some discussion around why do we have to do this right now? I ask you to look at Jackson, Wyoming. It's another tourist town. They actually adopted an emergency resolution just ahead of the July 4th weekend because there are so many people in town that they're concerned about it. I wanted to also comment on The science regarding increased number of tests leading to increased number of cases, the scientists have also said it's not that. It's the positivity rate, which is the percent of people tested who get it. So I understand that I've gone long. I think there are some other cities in the West that have a lot of tourists that we can look to for examples, not only in adopting the resolution, but in rolling it out. And Boise would be another one of those. And Driggs, Idaho, even. I mean, there are places close to home that you wouldn't expect to be doing this because they're getting more cases faster than we are. Thank you.
Thanks very much for the comments. Further public comment on this item? Further comments from the public? Yes, ma'am.
I was actually at home, and I was watching y'all, and I have been a part of this community for a long time.
If you don't mind just speaking into the mic, please, and your name and address for the record. You can keep your mask on if you'd like.
Cassie McNaults, 420 Colorado Avenue, here in town. As I was saying, I was at home, and I was watching this, and I wanted to be a part of the conversation. This is an incredible community. And I know that there's a lot of passion in this room. Just gather myself for a moment. I've been thinking about acceptance. And I actually had a conversation with someone today about how it's been a really difficult thing to accept this. This has changed our entire world, entire way of living, how we look at everything. And as a lot of folks have said tonight, it's not going anywhere. And so I finally decided, instead of spending all of this energy fighting against what we know is here, what we know is gonna be here, I'm gonna do what is difficult. This mask sucks. I work downtown. I work with people all day long, and it's frustrating, and it's hard to be understood and to communicate. But I started to view it as, this is a way for me to help protect other people as well as myself. I mean, this is a town built on tourism, and it was really scary for me to be at work, working with wonderful folks coming here from all over the country who may have been exposed unknowingly and may be exposing others. And so, I just want to say thank y'all for your time. Thank you, everyone. This is a great community, and this issue will only divide us if we let it. So, thanks.
Thanks for the comments. Thanks for coming down. Further public comment tonight on item 6A of our agenda. I'm going to go ahead and close the public hearing and turn it back to the council for discussion, questions of staff, or a motion, however you would like to begin deliberation. Ryan.
Angie, I have a quick question. That section 2 on page 4, the following guidelines, should that say should be followed? Is that a typographical error?
It's not a typographical error, but I think it would make more sense if it did say should.
Okay.
Mr. Mayor, would it make sense, or is there, Angie, is there a way that we might put for lack of a better description, a metric upon which this resolution would sunset if we were trying to do that? I think I've got it on this. Am I not being heard? Do you have a thought on that?
Yeah, I think we could make it sunset whenever the council thought it was appropriate to sunset, be that a month, 2 months.
Okay. Thank you. Mr. Mayor, I think I would move, if we could, as the beginning of this discussion, that I would add a provision to our resolution that would, in effect, give us an opportunity for this to sunset by its own terms within 2 months of the date of enactment, unless further extended by this council. based on medical evidence that we had at that time.
We can entertain that amendment, Frank. Perhaps
Thanks.
let's get a motion on the actual resolution first, and then we can do amendments from there. Ryan?
Mr. Mayor, I would move to approve resolution number 20-18, a resolution strongly encouraging the use of masks or cloth face coverings in public settings to help prevent the spread of COVID-19.
Is there a second to the motion? Second. Seconded by Councilor Norton. Frank, to your point?
Mr. Mayor, I would offer a couple of things. I think Ryan's reference earlier to the changing should to would or would to should, would like to incorporate that in this resolution. I would also like to add a provision that this resolution will, in effect, sunset within 2 months of the date of enactment, absent an extension by this council.
Is that okay with the first?
That's fine with me,
And is
Mr.
that
Mayor.
okay with the second?
I guess I would feel more comfortable if we went through the end of September, but are you just thinking because it's the summer tourist season? And, okay, sorry. I would be more comfortable if we extended it till the end of September, just because I think we'll still be having tourists at that point, but we can always extend if you think 2 months is adequate.
My thought on the time frame, Rebecca, was that 60 days would be an adequate time for us to get further evaluations as to what the spread has been or is as a result or not as a result of our actions. And we'll also have a better sense at that time as to whether or not we're going to get another bloom, if you want to call it that, of the virus by that time. And so we could evaluate in a more time-sensitive manner, is my thought.
Are you okay with those changes, Rebecca? Okay. Further discussion on the motion?
I would just say my first note here is the word mandate was thrown around a lot tonight, and I don't think this is a mandate at all. This is just, and I believe it was Ms. Clausen who summed it up perfectly. She said, I don't care if you want to wear a mask, then wear your mask. That's all we're saying. We're saying you should wear a mask. If you want to wear a mask, wear a mask. If not, no one's forcing you to wear a mask. This is not a mandate. There's no enforcement mechanism here. Another thing I had was, I believe Dr. Fauci is with the CDC and not the WHO. I could be wrong about that, though.
He's the director of our infectious disease national.
And then the last thing I'll say is I really just see this as a small sacrifice and a sign of compassion to those that are immunocompromised in our community. I know I have concerns about passing it on to my father-in-law, who is himself immunocompromised through his cancer treatment. And if I can wear a mask, I think it's a small gesture that I can make to him and to anyone else in the community. But again, it's just a suggestion.
Thanks, Ryan. Further discussion, comments? Andy?
First, a couple of things. I'll leave my mask on. Hopefully you can hear it. Although it fogs my glasses up, which I really find uncomfortable. But I had someone say to me the other day, you know, pants are uncomfortable, but I wear them for you. And I think that's kind of a good way to look at it. But I'm pretty confident that of the 67% of the people in our 528 letters that we got, or emails, no matter what I say to them that masks don't work, they're not going to believe me. And I'm super confident that the 30% of the people that said we don't want masks, I'm pretty certain that I'm not going to convince any of them, no matter how much science I pull out of the drawer, whatever rabbit hole I go down on the internet, I'm not going to convince them either. And the 3% that were kind of in the middle, I think they are like a lot of us. They're sort of in the middle. I want to correct one thing, or a number of things that were said tonight, and non-factual information gets spread around all the time. Of that 528 people, there were very, very, very few that were not Whitefish addresses. But what I will tell you is the preponderance of people that did not list an address were opponents to this. And there's no correlation or no judgment in that, but I did find that to be true. I actually did look at all 528, along with the 320 pages of material that I also read over the 4th of July weekend, because you know what, I take my job up here very seriously because I get paid big money to do it, and I really care about my community. So what we've done here, and I'm going to read this last line, whereas strongly encouraging the use of masks or face coverings in public settings in accordance with federal and state guidance will help ensure the health and safety of the city's residents and visitors. Now, we somehow in this country have lost the ability to compromise. We all think that our viewpoint is the only one that matters and that we are so unabashedly right and correct in everything that we do that we have no time or tolerance for others. And what we've done with this ordinance, or resolution, excuse me, is try and balance that. We have really tried to say, okay, there's people that don't want to wear masks, and I'm sorry, mine is slipping down a little bit. We're trying to strike that balance. We're trying to serve all of the constituents. Yes, we all get elected by a specific constituency, whether we're a governor, a president, or whatever, but at the end of the day, we serve every member of our community. And we have a large number of our citizens in this community that want us to have a mask mandate, and we have a lot of citizens that want us to just let it Katie bar the door and not do it. So what we've done is we tried to come up with that compromise, and I think that's an important thing in our public process that has been totally thrown out the window. And sadly, if anyone listened to public radio on July 3rd, the holiday, and the Declaration of Independence was read, if you would have listened to that, if you would go back and read the Declaration of Independence again, you would probably go, wow, we maybe need to make a change in our government in this country. It's pretty interesting. Those guys 244 years ago were brilliant. It's pretty awesome. So I think that's what we need to get back to. We need to just get back to, hey, not everybody's right and not everybody's wrong. We really need to just look out for each other, stop being selfish, and do what's right for us as a community. And that's what I think we're trying to do, and I'm going to vote in favor.
Thanks, Andy. Further comments on the motion? Ben.
Yeah. Thank you, everybody, for coming. I don't like wearing masks. In fact, I kind of hate it. If this was about my own health, quite honestly, maybe I would, maybe I wouldn't. But the point that I think sometimes gets missed is that this isn't about me. I don't wear it because of me. I think the masks, I think this is about the science. It is. I know people say otherwise, but everything that I've read tells me that if there are two people in the same room, one of whom is infected, and they both have masks on, the risk of transmission is extremely low. And so, that's a really important point. And I think that within our community, I don't like it, but I think that the possible outcomes if we don't all chip in are worse. We started off a couple weeks ago closing down the businesses. I don't think anybody wants to go back there. I know I don't. And I think that this is something, it's not going to kill anybody to wear a mask, and I think that it certainly may save lives. So I think it's an easy thing that we can do. I am supportive of this resolution, and I hope that everybody can live with it for a little while. And then as the science changes, as the situation changes, that we can adjust ourselves accordingly. With that said, I would like to bring up one point about the resolution itself that I might want to discuss up here. And it has to do with bullet point number 2. It says all individuals present in a city park or on a city sidewalk, shared use path, or right-of-way should wear masks or cloth face coverings. My best understanding of the science is that the risk of transmission outdoors is significantly orders of magnitude lower than the risk indoors. And I'm not sure how risky it is for our community, frankly, for somebody walking down one of the sidewalks by themselves. So maybe I should motion such a thing, but I would be in favor of changing that to possibly say something along the lines of outdoor gatherings of greater than 20 people, rather than blanketly requiring it across all of our sidewalks. That's all I have to say. Thank you.
I'll take that as a friendly amendment and a motion. Ben, is there a second to that friendly amendment?
I'll second that.
Seconded by Councilor Hennon, and I'll just reiterate, Ben, and correct me if I need to be corrected, that bullet number 2 on page 4 under section 2 be replaced with outdoor gatherings of 20 people or more, and may I offer, or cannot socially distance.
Yeah.
Is that okay with the second?
That makes sense to me. That's fine.
Any comments on the friendly amendment before we vote on the friendly amendment? Rebecca?
So I stopped working on March 17th because I was exposed to COVID. I have been masking since that time, and I've got lots of new masks. And so I'm learning how to pick different masks for different activities. But the other thing I did is I studied how our community does with social distancing, which is actually physically distancing. And there's numerous occasions where people can get by each other on our trails, but I've also seen numerous times when people's dogs would run up to other dogs, and then the people would have to come, or the kids were running away and the people would encounter each other. And so even when people are trying to distance, there's still an unintended exposure risk. So I'm not sure that the 20-person thing is going to work. I'd rather that people carried a mask, took it off if they were able to, and then when there was a potential for encountering someone less than 6 feet away, they could apply the mask. So I think if we don't encourage people to use them in outside situations, they will not, because they're not now. But downtown in particular, I think we have to do that, because there are a lot of people that are hanging around on the streets, and they do talk to each other, and they're not maintaining a 6-foot distance. And so I'm not going to vote for eliminating it outside entirely. I understand your point, but I've been watching people at the dog park. I've been watching people for 3 months now, and they are not maintaining distance consistently.
Thanks, Rebecca. Further comments on the friendly amendment? We'll vote on the friendly amendment before.
Mr. Mayor, if I
Frank,
might.
sorry.
In the context, I'm having trouble getting the darn thing back up on my computer. In the context, my concern is that particularly in the downtown areas where we know on the sidewalks it is impossible, given the numbers of people that we have in town, to socially distance. By definition, there are more than 20 people on the sidewalks at any particular time in downtown. I would like us to make it clear that if we're going to do this, that it would seem to me that we would need to identify areas such as downtown where we know by definition you can't because of the crowds. If they're in the dog park and there's nobody else around, God love them. Have a great time. But I think we run risks, given the purpose of this, which is to have me protect other people from me. And so I would be hopeful that that's addressed somehow here. And my concern then with your amendment is that it, as a blanket permission effectively to, if you're on a public sidewalk, I don't need to worry about it because it's not required. Does that make sense to you, or do you understand what my concern is?
I do, and I think it's hard, because I think that there are situations on Central Avenue and downtown in particular where you're right, although I struggle with the fact that that is a small part of what that bullet, for example, might read. I worry about people walking around, people at City Beach or wherever, and so maybe if we can confine it just to Central Avenue, I mean, I might, I guess, be okay with that, but it's...
Angie, comments?
Yeah, I understand those concerns, and I'm wondering if we keep this second bullet point as is, and then just add after it, when it is impractical to socially distance or when social distancing is unavailable. So, I mean, it would cover the dog park, it would cover Depot Park, it would cover the sidewalk on Central when it's not, you can't socially distance. So I'm just wondering if that language, rather than limiting it to certain group gatherings, would be a little bit more effective.
Can you repeat that suggested text edit, Angie?
Yeah, I can. So it would read, all individuals present in a city park or on a city sidewalk, shared use path, or right-of-way should wear masks or cloth face coverings when it is difficult or impossible to socially distance.
Ben, if you're okay with that suggestion, you can withdraw your motion, or we could bring it to a vote. Depends on your comfort level. That would be an added bullet.
Yeah, I'm thinking, but I do, in my mind, I do keep circling back to the science of it, and it is my belief. I know I read a long expose in the New York Times the other day that was talking about how they did a study of 7,500 confirmed cases over in China, and they found exactly one that was transmitted outdoors. And in my mind, it's an entirely different risk profile out there, and I think that it's summer, and I think it's wearing masks outdoors is not always the most pleasant thing to do in the summer. It is, I think, in my opinion, and I recognize that I'm one, everybody else may have different opinions, but I do think that the outdoor thing may not be worth it to me in terms of cost benefit, so to speak. But I certainly recognize if other people feel differently.
Thanks, Ben. Further discussion or comments on the friendly amendment? The friendly amendment, Ben, again, correct me if I speak out of line, would be to outdoor gatherings of 20 people or cannot socially distance. Rebecca?
So this is an example. I have, on my street, I have a family from New York City that just arrived, and another family from Seattle that arrived. And they were speaking to other neighbors 2 feet from them. They're not required to quarantine. Nobody is tested. They're outside, but they're still not maintaining 6 feet because they know these people and everybody loves these people. And so that's like everybody knew the rules coming here because they had to live in places with hot spots. And the moment they got here, it was gone. And so that's why I think if we maintain these requirements, what will happen is people like me had to learn this over the last 3 months. You will remember to always have a mask with you. When you don't have to have a mask, you don't have it on when you're outside. But if you do see someone that you want to talk to, you can just put the mask on. And that way, if they are infected, you're not, or you're infected. And so the reason why it's happening now after all the confusing months up to this point is because now we know definitively that asymptomatic carriers are 20 to 40% of cases. That means people will never have symptoms. And also there's pre-symptomatic people that are sick for 5 days without any symptoms. They don't know they're sick and they just go about their regular routines. And so the CDC changed their recommendations at that point because they also found out from doing testing on asymptomatic people that 10 times the number of cases are actually out there. So I originally presented a long time ago an email to you guys saying it was a 7-time fold increase from Columbia University, but now we know it's 10 times the amount of actual infected people that are beyond the tested. So that's the thing, is that's the only reason we would even use masks, is to try to contain the virus from the people that are infected that might never know it, or they will come down with symptoms within 5 days. And we never know when those encounters are going to be. So.
Thanks, Rebecca. Further comments on the friendly amendment? All those in favor, please raise your hand. Those opposed, like sign. And the motion does carry on a, Frank, how did you vote?
I guess.
On a 3-2 margin with Councilors Sweeney and Norton voting in opposition. That brings us back to the original motion for approval as amended on Resolution 20-18. Further comments?
I'd like to say some things. Okay, the community can blame me for this because I brought it to the table. I work in healthcare, and I have for 36 years now. And so I do follow the science every day. For at least an hour, I read science about where we're at with things. It's fascinating, but it's very complex, and it's a global health issue. And so at first I was terrified, and now as I'm seeing these solutions coming through, I'm actually quite hopeful that we will get there in time. But that means that we have to take it seriously. I really appreciate everybody doing their research to, from their standpoint, bringing it to our community decision-making body, which is the City Council. I am very worried that we will have to go back down into some kind of shutdown economically if we don't do something like this. At the present time, there are 28 states with face mandates, and numerous cities are doing this. And so we're kind of the last people, because we're way up here, there's not that many people, but all around the world this is going on to try to control this virus. Some of you guys brought up some really good ideas about masking. For instance, if you could get sick from breathing CO2, if that were the case, the surgeons would not be wearing masks all the time. So there are people that will not be able to mask, we know that, and there are people that will refuse to mask. That's fine. If you have young children, they should not be masked. If you're going to be sending them back to school, though, you probably should practice masking in case that helps them. But for those of us that actually believe that this is a mechanism for helping our neighbors and our community and stopping the spread of a deadly virus that has no cure, it's a small thing to do. It takes time to practice learning how to use a mask, how to take them on and off. And so that's why I'm encouraging us to proceed right now. I like the idea of trying it for a few months. I'm hoping we don't have to do it for 2 years. And what a lot of people don't know is it's only maybe 10% of the people that are dying of this, but up to 20% of people are developing pretty severe organ damage. A lot of people are healing from it, but it's a blood disease, and so there's a lot that we're still discovering about how it functions and what the long-term effects are on people. So until and I do work in healthcare, so this is why it's interesting to me. I think all of the letters that we got from the doctors and the nurses that I know in the community urged us to proceed with a masking initiative. So it's okay if you don't buy into this. I know there are many, many people who will, and we're hoping that by encouraging the community to do so, that many businesses will be able to protect their employees from getting infected and also to stay viable. So I just wanted to say I did read your letters, and I actually tried to listen to all the the science data that you were bringing up. But I've been following it, so I do know pretty much what's current. And I think this is in the best interest of our community at this time to proceed.
Thanks, Rebecca. The one thing I will say to your comment is we all brought this forward, and Rebecca did initiate it, but she had the full support of this council for consideration tonight. So I wanted to be clear on the record regarding that, and then it's not a mandate. With that said, all those in favor, please raise your hand. Those opposed, like sign, and the motion does carry unanimously. And we're going to go ahead and recess, and we'll come back here at about 9:20. We're going to go ahead and get started. We left off on item 6B of the agenda, which is consideration of a request from Big Mountain River LLC for an 8-lot, 20 sublot subdivision located at 244314 and 322 West 2nd Street. The property is zone WR3, which is our low-density multifamily residential district. Wendy.
All right, good evening. So again, this project is a residential townhouse subdivision with 8 parent lots and 20 sublots for a townhouse subdivision. This project originally was scheduled for planning board a couple of months ago. At that time, they were proposing a 17-unit subdivision and proposing to do fee in lieu for all of their affordable housing. After receiving comments from the Whitefish Housing Authority, they went back and they revamped their project in order to provide affordable housing within the development itself, and so that's the plan that you're seeing before you. So the project will have a single access off of West 2nd Street, and there will be a private loop road that will go through the development. There will be internal sidewalks for access to all the units, a paved trail along the western property line that's open to the public, and parking provided within garages and a couple of surface parking lots distributed throughout the site. There are open space areas to the north of the project along the Whitefish River. There's the Whitefish River buffer, which will contain a private homeowner pedestrian path to the river along with a homeowners association dock. Noxious weeds within the open space will be mitigated with a revegetation plan. The open space area to the west will contain a 10-foot wide paved pedestrian bicycle path within a 20-foot easement. This trail will connect from West 2nd Street to the new trail path system in the 95 Carroll project. And I have a map showing what that would look like too for you folks. The path will be built to city standards, except for grade standards. It's a little bit steeper than our standards, but it'll be open to the public and maintained by the homeowners association. Within the project, there's 3 lots. There is a unimproved 20-foot wide public right-of-way called Hendricks Avenue, and it divides the Hendricks subdivision from the Grandview subdivision from way back when. This substandard unimproved right-of-way is very steep, and it terminates straight into the river. Within the southern portion of that right-of-way is a sewer main, which comes from Carroll Avenue, bisecting the Hendricks tracks and then connecting up to West 2nd Street. There's also a 2-inch water line from West 2nd Street that goes in the right-of-way and then underneath the river and serving 2 residential lots to the north of the property. The applicant is proposing to vacate this right-of-way, leaving the sewer main and water main within an easement and locating the trail, as described previously, within a new easement along the western property line. As part of the application, 2 subdivision variances are being requested. One which limits the number of flag lots in the subdivision to less than 50%. The applicant is proposing 10 of the 17 to be flag lots. And then the section that requires streets to be designed to the adopted city engineering standards for both public and private streets. In order to comply with the Legacy Home Program, the applicant is proposing to develop 3 deed-restricted units and pay the 1.5 times fee for the 4th unit. As such, they're also using the reduced lot size, reduced lot width, and increased lot coverage as permitted through the Legacy Homes Program. Again, the property is located on West 2nd Street. It's currently vacant. There were 3 older homes that were removed a bunch of years ago. The property is zoned WR3. It is surrounded by residential uses. There's a professional office to the south, and again, the 95 Carroll project is to the north. The project is served by all public services and facilities. We did notice adjacent landowners. We actually notified them twice for the May planning board, and then they postponed it until June, and we didn't receive any comments. We review subdivisions according to the criteria in the subdivision regulations, just to hit some of those highlights. There is a portion of the Whitefish River that is in the floodplain, but this will be within open space area, and there's no proposal for development except for the trail and dock. And then they will be obligated to get a permit from the Conservation District, and staff will recommend this as a condition of approval. As far as access, there will be 1 main vehicular access. MDT has reviewed the application and noted the change in the approach will likely require an approach permit, and any work within the right-of-way will require a permit from MDT. And so staff will recommend that as a condition of approval as well. The project doesn't require a TIS because the traffic is less than 200 trips per day. And then West 2nd Street was improved several years ago by MDT. There's an existing center lane for vehicles to use when making left-hand turns into the site from the west. And then the design of West 2nd Street was included the installation of sidewalks and boulevards. There's no mapped crucial wildlife habitat, but it's very likely that deer and other animals travel through the property and along the Whitefish River, and preservation of these buffers and open areas will help maintain those. The site has been graded and filled over the years to accommodate the former residential homes. It's flat to the south and then drops off down to the river. There are building sites within 200 feet of the Whitefish River on slopes that are likely in excess of 10%. So our regulations say that a geotech letter is required at the time of building permit. We've suggested that as a condition as well. The applicant's proposing to protect the Whitefish River with a buffer and setback, meeting our water quality protection regulations. And back in 2017, the city hired Randy Overton. He was the one who helped develop some of the buffering setbacks in the steep slope section. To have him review a top-of-bank determination in this neighborhood. And as part of this assessment, we also had him look at a few other lots that we knew would probably be developed at some point in the future, and the easterly lot is one of those lots. So our Whitefish River buffer requirements is 75 feet or top-of-bank, whichever is greater. Once they overlaid the 75 feet with his determination of top-of-bank, they found that the 75 feet was actually greater. In addition, there's a little narrow wetland along the river, and so we measured the buffer from the edge of that wetland, so that even pushes it up a little bit further. So the applicant is also proposing to do a little buffer averaging. So they're kind of squishing the buffer in some places and making it bigger in other areas. But overall, there's a net increase in buffer square footage. Under allowed activities in the buffer, again, they're proposing to put a private path and dock, which is a permitted use in the water quality protection regulations. Drainage is proposed to be collected within the private road, treated and directed towards the river. And the plans will be reviewed by the Public Works Department. Water is in Highway 93 West, and so they'll be connecting to that. This project will require 17 ERUs. They do get a 3 ERU credit as part of the keeping track of the ERUs for Department of Environmental Quality. The private street will be privately constructed, owned and maintained, but open to the public. Staff is recommending a condition of approval to sign the street for no parking. There is one existing driveway that will be eliminated to the west. And then staff is recommending a condition of approval that the curb and boulevard be restored, and depending on spacing with street trees, they may require the installation of street trees. So we have recommended that they coordinate that with the Parks Department. The applicant is proposing to set aside 0.86 acres of open space, which is 36% of the site. According to our subdivision regulations, the preliminary plat is exempt from parkland dedication because they are providing long-term protection of a water quality protection area, which exceeds the requirements of the subdivision regulations. So our parkland requirement would be 0.16 acres, and they're providing 0.86. The applicant is proposing an important connection to the Whitefish River pedestrian path. Let me show up this map. I don't know, I could probably try and zoom in, but this is an overlay map showing the Big Mountain River project kind of in the center in the red, and then you can see the trails as they go around the 95 Caro project, and there's kind of some call outs there describing how they're connecting. So this path will connect West 2nd Street to the trails within the 95 Caro. While not shown as a path as part of the Whitefish Connect plan, due in part to the extreme topography of Hendricks Avenue and 95 Caro development not being fully contemplated at the time that the plan was being developed, this is an important trail connector bisecting West 2nd Street block between the downtown and Caro Avenue. And the Connect Whitefish plan does state that the city should continue to prioritize connections between the Whitefish River Trail and existing pedestrian bicycle facilities. So this trail is proposed to be a 10-foot wide within a 20-foot easement, but owned and maintained by the Homeowners Association. The trail grade will not be as severe as it would be if it was in the Hendricks Avenue, which is severely steep. But staff is recommending the trail be signed warning trail users of its steepness, and we've recommended that as a condition of approval, along with the vacation of the Hendricks right-of-way. We don't anticipate any negative effects on agriculture. It complies with the growth policy. As far as the Legacy Homes project, they would be obligated to provide 4 units. In the housing mitigation plan, the applicant is proposing to deed restrict 3 of the units and pay a fee in lieu for 1 of the units. The 3 units will be 2 2-bedroom, 1 at 90 and 1 at 120%, and 1 1-bedroom at 80%. So the Legacy Home program, as you all remember, requires an average of 100%, and these folks are being a little bit less at 96.6%. They're also proposing to pay a 1.5 times fee for the 4th unit. The HMP indicates that if the 4th unit, if they can figure out how to make that feasible within their development, is just so early in the process that they'll also provide a 4th unit. But at this point, they're interested in paying a fee in lieu for the 4th unit. The Housing Authority and their board reviewed this proposal and is in support of the request, and they're appreciative of the inclusions of 3 units and a payment for the 4th unit. So as far as the variance request, so again, they're proposing flag lots, which would be all the lots kind of on the back side of the subdivision, those that don't front straight on West 2nd Street. And then the fact that the private road is less than 28 feet, which would be our standard, or narrowest and standard, and they're proposing at 20 feet. With sidewalks on both sides of the north portion of the loop, but not the south portion, and street trees will be located in boulevards. So the council is required to make a finding that the variance criteria are being met as part of this project. So one of the criteria is granting the variance will not be detrimental to the public health, safety, or general welfare, or injurious to other adjoining properties. The granting of the variance will not be detrimental to the public health, safety, or welfare because the project is providing adequate space for vehicle maneuvering. The applicant is going to work with the fire department to assure that emergency access is provided, and they'll also work with MDT on their access, and all development standards are being met. Neither the alternative street standard nor the flag lot should have any impact on adjoining properties. The variance is due to physical surrounding shape or topography, conditions of the property involved. Strict compliance with the regulations will impose an undue hardship on the owner. The applicant is requesting this variance due to the lot shape, configuration, and topography. The property is located on the Whitefish River. It's not a standard lot and block kind of property where there'd be easier opportunities to develop a public street. And so due to the limited area to develop with the river buffers and stuff, the private road meeting all the fire department requirements was the solution to develop this at a WR3 zoning. The applicant's not claiming a personal or financial hardship. The variance should not cause an increase in public costs, and the variance will not put the subdivision in nonconformance with any other city regulations. Okay, so staff found that the variance criteria are being met for this subdivision. The planning board held a public hearing on June 18th. The applicant spoke at the public hearing. The minutes are attached for your review, and the planning board unanimously recommended approval, subject to 23 conditions of approval. Some of the highlights of those conditions: number 7, approach permit must be obtained from MDT. The existing driveway must be removed and restored with curb gutter, boulevard landscaping, and coordinated with the Parks Department for any street tree installation or removal. The street must be signed for no parking. The final plan for buffer restoration and averaging must be submitted and approved prior to the issuance of building permit, and geotech letter must be submitted along with the building permits for lots 4 through 8. Condition number 15, the public trail connector from West 2nd Street to the north edge of the property must be installed. The path will be open to the public but owned and maintained by the HOA and signed for steepness. The Hendricks right-of-way must be abandoned, and a 20-foot wide utility easement provided for the sewer main and water main must be provided. And then compliance with the Legacy Home program will be met through deed restricting 3 of the townhouse units and paying $116,930 at the time of final plat. Can I answer any questions for you?
Thanks, Wendy. Any questions for Wendy on her staff report from the council? Not seeing any, Wendy. Thanks very much. We did advertise for a public hearing on item 6B of our agenda. We'll hold that public hearing now. Dave or Bruce, did you have anything additional to add to Wendy's staff report? Yes, okay.
Good evening. I'm Sierra McCartney with Bruce Booty Landscape Architect. Our business address is 301 East 2nd Street. With me tonight as part of the project team is Bruce Booty with Bruce Booty Landscape Architect, Dave Verdati, who's the owner representative as well as one of the owners of Mindful Designs, and Doug Pepmeyer with TD&H Engineering is also here tonight. We would first like to just make one correction to the staff report. On page 14, it says that the applicant has requested 2 variances. And then if you go to the recommendations on page 16, in the introductory paragraph, it states there's only 1 variance. So we are requesting 2 variances. Other than that, with the staff report, we are in agreement with the findings of fact, as well as all of the conditions of approval. So Wendy has given a thorough overview of the Big Mountain River project, but we just wanted to highlight some of the benefits of the project. One of the benefits being the aesthetic value of the development. So a lot of thought and time went into the design of this project, and a huge focus of the design was put into creating a pedestrian-oriented development and to really try to make something that's visually appealing from 2nd Street. So all of the townhouse units along 2nd Street have their front entryways facing the public street, and then their garages and vehicular access points are out of view located behind the townhouse units. So the private drive that loops around the development, on the south side, the private drive acts more like an alleyscape, and it mimics somewhat of a traditional alleyscape with the garages facing that private drive. And then on the north side of the private drive, it's supposed to mimic more of a traditional streetscape. So on either side of the private drive, there are 6-foot wide boulevards, and those will be planted with street trees. And then there are 5-foot wide pedestrian sidewalks. So the goal was to take what we love about the residential areas in the older parts of Whitefish and to apply it to this development. And while we can't follow it completely, it's to take the things, part of the things that we love about those streets and to apply it to this development, even though this is a more challenging site and we aren't able to do a full block and alley design. Another huge benefit of this development is that it creates a walkable community. So like Wendy mentioned, on the west side of the site, there's a bike ped trail, and that links to the future 95 Caro trails, which then will link to Sky Park Bridge and the BNSF loop. So this is a key, or just one more link to our incredible trail network in town, so that provides a huge community benefit, even though this trail in particular is not ADA compliant, and that will be signed. And then on the south side of the site, there's a sidewalk, the newly constructed 2nd Street sidewalk ties this development right into downtown. So it's only a 1/4 mile from the Veterans Memorial Park, which puts you right in the downtown business district. So as part of that walkable community, this ties into smart growth and creating developments that are in infill areas instead of outside of city limits where we're taking up open space and creating sprawl. There are a lot of open spaces proposed in this development. So we are required to have 0.16 acres of dedicated parkland, and we have 0.86 acres of open space. So that's over 500% of what we're required. And that is because we're following the Whitefish water quality regulations with the 75-foot buffer and 25-foot setback. And so that's protecting those critical areas along the river and the wetland. One concern that was raised in planning board was the density of this project. And so we wanted to address that. The entire property is 2.5 acres. And in this WR3 zoning district, they require a minimum of 2,400 square feet for an attached one-family dwelling on a sublot. So if zoning was our only constraint in this development, we would be able to have 45.3 units, and we are proposing 20 townhouse units. In addition, the growth policy proposes a land use designation of neighborhood mixed-use transitional, which has a density range of 2 to 6 units per acre, and we're proposing 8 units per acre. So that falls right in the middle of the growth policy.
2 to 16.
Sorry, I said that earlier too. 2 to 16, and we're at 8. Just to touch on affordable housing, Wendy mentioned it earlier, but originally we proposed to do all 3 units as a fee in lieu. And the Whitefish Housing Authority recommended that we go back and try to fit the physical units on site. And so we went back to the drawing board, and it was challenging, but we managed to fit 3 more units in, and that was incredibly excited because that made it pencil out, and it made us able to actually provide physical affordable housing units. So this project is in support of affordable housing and is very excited to be able to provide those units on site. One last point, this subdivision will follow Firewise landscape. And, you know, wildfire is becoming one of the biggest threats to our community, and so we just wanted to highlight that the landscaping will follow the defensible space standards. And lastly, Dave just wanted to touch on the building efficiency.
Sure. Yep. Thanks, Sierra. Hi, I'm Dave Rodati with Mindful Designs. Just to touch on climate consciousness of like our building approach for the development. I'll keep it short and sweet. There's a lot you could talk about in that regard, but I'll hit on 3 major points. From a superstructure and building envelope standpoint, when it comes to building sustainably in our climate in Northwest Montana, first and foremost, you need to build it tight and ventilate it right. And we'll be applying the whole house building science approach and following through with mindful attention to detail. These homes will demonstrate highly effective and continuous air and water barriers and thermal envelopes. And that's pretty much the build it tight part. For building it right, all the units across the board will get state-of-the-art heat recovery ventilators, which basically amounts to a calculated, filtered, and measured air exchange where every drop of air in that house is exchanged every 3 hours and 20 minutes. And that's kind of the nuts and bolts of a highly efficient, durable, longevity, oriented, and air-wise healthy environment. Alternative energy-wise, will apply reinforced roof design and properly placed conduit with auto transfer switches on the front end so that the homes are adaptable to a pretty quick upgrade to PV panels, which is going to be just around the corner for those to actually start to pencil out up here, where up till recently it just hasn't really added up, but we're planning on that coming around the corner. And likewise, we'll make the homes ready to upgrade for an electric car charging ports. Both of these things aren't going to impact the initial home prices very much, but it makes a world of a difference if you set them up to accommodate those upgrades easily down the road. And that's the goal with that. And then, material-wise, on the third tier of a sustainable approach, in general, we'll just do what we do and like to employ an honest expression of local materials. Let wood be wood, let stone be stone, minimize shipping and processing as much as possible, and let the materials of our local vernacular speak for themselves. And sort of, those are bullet points of the three major tiers of a kind of being climate conscious with how we're going to approach the buildings within the subdivision. Thanks.
Thanks, Dave. Anything further, Sierra? Thanks very much. Bruce, anything to add? All right, we'll go to public comment. Any public comment tonight on this item? Any public comment? I'll go ahead and close the public hearing and turn it back to the council for a motion. Rebecca.
I'll make a motion to approve, let's see, sorry. It would be WPP 20-01 with conditions, sorry.
23 conditions and the attached findings of fact.
And the findings of fact.
Great, thanks, Rebecca. Is there a second to the motion?
I'll second.
Seconded by Councilor Hennon. Rebecca, would you like to speak to your motion?
Well, this property's come before us before in different ways, and so it's nice to see it finally develop. It sounds like a very thoughtful project, and I'm really glad that you're able to provide some connectivity and affordable housing in particular. So thank you for bringing it through.
Thanks, Rebecca. Further comments from the council? Ben.
Yeah, I just wanted to say I also think I appreciate the thought that went into this, and I also appreciate the fact that you took the effort to redesign this to include the units on the lot. I think that's important, and I think hopefully that's what we see going forward. So thanks for doing that.
Thanks, Ben. Further comments from the council?
Just
Andy.
a question for Wendy or Angie. Do we need a separate motion to approve the two variances also?
Okay. Would you like the motion on the table to be voted on first, Angie, and then the variances, or the opposite?
I think the motion on the table to be voted on first and the variances.
Okay, great. Further comments on the original motion? All those in favor, please raise your hand. Those opposed, like sign, and that motion does carry unanimously. Andy, you prepared to make that motion?
I would make a motion that we approve the two attached subdivision variances as requested.
Is there a second? Seconded by Councilor Norton, I believe. Further discussion? All those in favor, please raise your hand, and those opposed, like sign, and that motion does carry unanimously. Thanks for your time tonight. Appreciate it, and good luck with the project. You guys, you're creating some nice products out there, and you should be very proud of them. They're sharp. Thanks for waiting, John. That brings us on to item 6C of the agenda, which is consideration of a request from John Shigo and Christina Larson for a conditional use permit to construct an accessory apartment in an existing structure located at 725 Summers Avenue, and the property is zone WR2, which is our two-family residential district. John, thanks for hanging out through all that. Glad to get to you. Wendy.
All right, this should be the easiest accessory apartment ever.
So it's an existing structure. They built it a number of years ago. It meets all the setbacks and accessory standards. They're just simply finishing out that second floor. So the building, again, meets all setbacks and height and standards. It's located at 725 Summers Avenue. It's developed with a single-family residence and a detached two-story garage. It's surrounded by residential uses on WR2 with an urban land use designation. The property is served by all public services and facilities. We noticed adjacent landowners. We received one comment in support of the request. The project complies with the growth policy. It meets all the zoning requirements. The site is suitable for the proposed site. The site plan can meet all of the development standards. There's adequate water and sewer, and it shouldn't impact the neighborhood community. There's a number of accessory apartments. So staff is recommending approval. We held a public hearing on June 18th. Subject to 6 conditions, the planning board did recommend approval unanimously. And the conditions are the standards ones you usually see, including a deed restriction. It's valid for 18 months, and there's an existing unpaved driveway that must be paved as part of the project. Can I answer any questions for you?
Thanks, Wendy. Any questions for Wendy on her staff report? Not seeing any. Thanks, Wendy. We did advertise for a public hearing on item 6C. We'll hold that public hearing now. John, do you have anything to add as the applicant? And you don't have to.
I've just sat around for a while. I figured I better get up here. No, I just wanted to say I appreciate you guys putting this in front of you guys tonight. It's an existing structure that my wife and I had built a number of years ago and are just at a spot now that we believe we want to add a bathroom and be able to take advantage of it. So I think Wendy and the planning department did a really great job of putting it forward, and I hope you guys would approve our request.
Thanks, John.
Thanks.
Appreciate it. Any public comment tonight on this item? Any public comment? I'll go ahead and close the public hearing and turn it back to the council for a motion. Ryan.
Mr. Mayor, I would move to approve the consideration, or I would move to approve the request from John Shigo and Christina Larson for a conditional use permit to construct an accessory apartment in an existing structure located at 725 Summers Avenue, Zone WR2, two-family residential district, WCUP 20-08.
Is there a second to the motion? Seconded by Councilor Sweeney. Further discussion? All those in favor, please raise your hand, and those opposed, like sign, and I believe that's unanimous, Michelle. Thanks, John. Good luck with the project. We'll move on to item 7A, which is a consideration of a determination of exemption hearing request from Kelly Lab, and the property, as we are aware, is located at 777 Dakota Avenue, and again, this is a continuation from our June 15th, 2020 meeting. Wendy.
So Dave was here 2 weeks ago to talk to you about this. So I'm just here really to answer any questions. Again, we still believe that it's an evasion of subdivision, what the request is. And I think it's important to note that this applicant could still apply for a subdivision, and these types of things, dedication of right-of-way, sidewalk installation, parkland dedication, would all be part of the subdivision review like the one that we just looked at. The other aspect that would be included as part of a subdivision would be the Legacy Homes program would get to apply. And there's many options, as you all know, through the program that we put together. There's paying the fee in lieu of 1.5 times, or building a unit for sale on another lot. So there's lots of opportunities to incorporate affordable housing. Not necessarily within the development itself. One other aspect of going through the subdivision process is it would be fair for everyone. Like the last applicant we just heard from, they went through subdivision review. We noticed the adjacent landowners. We put a sign on the property. We do, this big public process, so all the neighbors know what's going on. So I just wanted to kind of point out those couple of items for you folks.
Thanks, Wendy. Any questions for Wendy on her update?
And then Angie's available to answer any questions too for you.
Questions for staff? I had one, and I believe I know the answer to this, but the Marina Crest right-of-way has already been deeded to the city, correct?
Correct. That happened
when it was formerly subdivided?
When the subdivision to the south.
Right.
I have the aerial if you want to put that up, Michelle. The subdivision to the south was done, I think, in the early 2000s, And while it terminates now in a cul-de-sac, they did dedicate that right away all the way to the edge of the property. And then the quarry project, they dedicated all the way to the edge of the property as
So
well.
the extension ties into the cul-de-sac?
Correct.
In that short section, does the?
Yep.
Okay.
Yep.
Was the thought then that the cul-de-sac would eventually go away?
I've never really
Okay.
delved into
I
that
just
file.
was
I
wondering.
couldn't say, yeah.
Okay. So it's a pretty short section of road
I don't know what the, yeah, I mean,
between where the quarry terminates and the head of the cul-de-sac or end of the cul-de-sac?
yeah, I don't know what that length is.
Okay.
But it is pretty short-ish.
Okay.
But those, you know, dedicated, or the road's already dedicated, but improvements to the road, I mean, those, all of those types of things would come out through subdivision review process when that would happen.
So Angie, in terms of action tonight, if the council elects to overturn Dave's recommendation, then that would of course be the motion. Is any motion required if they elect not to? Affirm his ruling?
Yeah, I think you're still going to need to do that by
You'd
motion.
still like a motion to that, either way?
Correct.
Okay, thank you. Just out of courtesy for the applicant, do you have anything additional to add, Sean? Or Kelly, for that matter?
Yeah, I don't think it's anything additional, just that respectfully, our position stands that not only is it legally not a subdivision, but also the procedural errors that I talked about in my letter. And I think we left the last meeting kind of with the spirit of compromise, and I think that that's been carried through over the last couple of weeks, working with Angie to get the agreement that's in your packet. And I believe that Doug worked well with the planning department to get those terms reached. So we're hoping that we just continue on that vein.
Great, thanks, Sean. Frank? Microphone? Just closer if you don't mind. Yep.
And it says here that they're going to deed restrict the property to no more than 4 lots. That doesn't tell me that those 4 lots can't be further subdivided.
It's a max of 4.
But each one of those lots, given the zoning, could be further subdivided and density placed on those lots. Or more, let's put it this way. This doesn't indicate to me that there are only going to be 4 homes on those, a total of 4 homes on 4 lots. Because there could be multiple units on any one of those lots. The way I read this.
I'll go ahead and acknowledge Doug Peppemeyer, the engineer of record on the project.
Doug Pepmeyer, TD&H Engineering. So to address your comment, if you deed restrict it to 4, it would limit it. So what we were saying last time is right now, I believe, and Kelly, correct me if I'm wrong, there's a deed restriction of only 8. But let's say they did want to subdivide, even if they split one of those once, that's a major subdivision, and the rules and regulations of the subdivision would be applicable at that point, like Wendy outlined. So whatever, you know, is required for subdivision, they would have to do that because it's a major subdivision. Any other questions?
Do you agree with that, Angie?
I do.
Okay.
I think it would be, the details would be in how the deed restrictions written.
Okay, correct. Great. Thanks, Doug. Ben?
Angie, or Doug, or whoever. I don't see anything in the requirements about it being a single-family home on the lots. Is that, we believe that that is part of the requirements, is that it is developed as single-family homes?
That's my understanding of their intent.
Intent, but I don't see the language. Anybody?
I'll acknowledge Bruce.
So in our earlier application, we stated that the development of each of these parcels would conform to the zoning regulations that are in place. So I believe that would allow you a single-family home or a duplex, and with a conditional use, you could have a guest house, but it would not allow multifamily dwelling units.
Thanks, Bruce. One option you have is put a motion out there, and it'll obviously spark some discussion, and we'll see where it goes one way or another.
I'd like to make a motion to uphold our planning director's initial decision that this was an evasion of our subdivision requirements.
There is a motion on the table to affirm our director's findings. Is there a second to the motion? And the motion fails for lack of a second. Well, if you weren't in favor of affirming, I imagine there could be a motion coming to overturn. At least just to keep the discussion moving. Yep, I understand. Ryan.
Mr. Mayor, I would make a motion to overturn the planning director's decision regarding the request from Kelly Lab located at 777 Dakota Avenue.
Is there a second to the motion? And that motion fails for lack of a second.
I'll second for discussion.
Okay, seconded by Councilor Fury.
Keep us moving anyway.
Yep. Ryan, would you like to speak to your motion?
Well, I guess I would kind of echo what Mr. Frampton said about, it felt like we were here 2 weeks ago, and we kind of hammered out a deal at the last minute, and I don't know, it kind of gives me some heartburn to have them leave 2 weeks ago with the feeling that they were going to give up some things in return for the city signing on to this agreement. So that's why I made my motion, and I'm kind of curious to see what the other counselors' thoughts are on that.
Rebecca.
I think our city generally really tries to accommodate people when they have special needs. We have a board of adjustment, and we have many ways of helping people work with their properties. However, some of our hardest things to accomplish are things like our transportation plan, emergency service things, connectivity, and affordable housing. And so I like the surety of knowing when someone goes through the subdivision process that all of those long-term plans that we have as a community that benefit all of us, that are sometimes hard to accomplish for many, many years, are addressed during the process and fairly addressed to every applicant that comes forth. So to me, the last 2 weeks when we went through this, that was the telling sign that we were off track, because the couple came in to discuss a subdivision. They did not like certain sections of the subdivision that were required to do their project. They found an alternative way to do it, and then this council then started to broker a deal about what was acceptable to them and what was not acceptable to them. And that's part of the reason we have subdivision rules, so that we don't set precedent, that people can pick and choose what is desirable to them. And so I it's a hard part of growing a community, but it is one of the reasons why I love our planning department is they have to go through all the many, many details of making sure that we're growing functionally and fairly. And so and also being the chair of the Wisconsin Avenue Corridor Plan, I am really afraid that if we give up a road or, you know, negotiate things away that, anyways, that we're not following our long-term guiding principles.
Thanks, Rebecca. Further comments on the motion? Frank?
I think I stand guilty of doing what you said, and I truly appreciate what you've just said and to honor what what our planning department offered. I'm also cognizant that Ryan and I and several others did work very hard at the last council meeting to see if there was a way we could work a compromise. Right now, for the time being, I'm going to move forward in terms of talking about why or how I could possibly support or Ryan's motion. I think it works for us in that it provides, this agreement would provide, at least in my view, everything we would otherwise get under a subdivision review, absent a contribution to our affordable housing program and the Legacy Homes program. That, when I realized that was the problem, I thought about the alternatives to them, how they could have otherwise dealt with it and addressed that. And there were a number of ways, and they're, quite honestly, I think they're quite affordable. Being a good member of this community at this point requires that we all contribute, I think in some form or fashion, to our affordable housing program to see if we can make it work. This compromise that we indicated we might otherwise entertain last meeting doesn't go that far. It doesn't give us that contribution to our community that we would otherwise expect from any other development that would have to come through the formal subdivision process. That said, I think I have to live a little bit with what I was willing to live with 2 weeks ago. If this agreement said that in restricting the property to no more than 4 lots, and on each lot only a single family home, not a duplex, can be built, I could live with that because that's the deal we brokered, or that I thought we had brokered. With that said, if we amend this agreement now to reference that only 4 single-family homes can be placed, or 1 single-family home can be placed on each of the 4 lots, I could live with this and would support it. Absent that, I can't. So with that, I would move that we amend a friendly amendment to your motion to amend the recorded agreement, or whatever this is called now, to reference in section D that no more than 4 lots and no more than 1 single family home per lot would be allowed.
I'll take that as a friendly amendment. Is there a second?
I'll second.
Seconded by Councilor Hennon. Frank, I think you've spoken to your motion. Any comments? Now we're going to vote on the friendly amendment. Angie, please.
I would just say that I think you could make your approval contingent on that, but the labs would have to agree to that. This is really not an agreement so much as it is their conditional dedication to the city. So I think if they were agreeable, you could do that, but I think what they've offered you right now is what they've offered you right now.
Okay. Sean, would you like to respond to that, or Kelly? Yeah. If you don't mind approaching your name and address for the record, Kelly.
Kelly Labs, 156 Wild Rose. We're fine with the single family. We don't need a duplex. We would want to have all of the ability that anybody else in that same zoning would have. Anybody in downtown Whitefish, for that matter, as far as an outbuilding or to be able to use our property.
And that would be through a formal conditional use process, correct? The
Well,
detached?
not an outbuilding, a guest home would be a conditional use permit, correct, Bruce? Yeah. But we're not looking for a duplex. And again, we're not looking to maximize or monetize this, it's single-family home.
Does that answer your question sufficiently?
Yeah, I think we could amend the conditional dedication to reflect that.
That would not preclude them from the ability to come in at a future date, Frank, though, for a CUP for detached garage apartment, just so you're aware. Okay. Okay. Further comments on the friendly amendment? All those in favor, please raise your hand. Those opposed, like sign, and the motion does carry on a 4-1 vote with Councilor Norton voting in opposition, which brings us back to the original motion for approval. Any further comments? Frank, the only thing I would mention is, and correct me if I'm wrong, Angie, that I believe through subdivision, they would likely be required to extend Marina Crest and perfect that east-west connection. And I don't think that was mentioned.
No, John, you were, and it was, and I actually had a long conversation with Wendy today asking about that very thing. If they were to come in and offer what they've offered now on simply 4 lots, 4 single-family homes, on that, the likelihood that we would require as part of the subdivision, them continuing or extending that road was not high in her view. And so I think, okay, fine.
Great, thank you for that.
Thanks.
Rebecca, question?
So I just want to be clear, if you guys are going to broker this deal, what you've done is give away an opportunity for an affordable housing bonus, and then also a connective road. Am I wrong on that?
The right-of-way is already deeded to the city, dedicated, I should say, through the previous subdivision process. And what I heard from Frank, who had discussions with Wendy, is it would not be required that the developer perfect that east-west extension because it's only a 4-lot development. If it were a 56-unit development, which is probably what could be allowed on that property if they went through standard major subdivision, given the zoning and the density, they probably would be required to extend.
See, that's different than what I heard last time. I thought that they would be required to pay for that. And that was what I thought our public works director said. But
do I stand corrected, Craig? If I am, please mention so.
Craig Workman, Public Works Director. So the way that the engineering standards read, it would likely be a condition or a recommendation of staff that Marina Crest be extended to what would be the easternmost extent of this subdivision. We have, with the previous subdivision, the quarry, to the east of this required that when they do develop that second phase, that they improve Marina Crest. And so in the transportation plan, it's pretty clearly laid out that eventually Marina Crest will connect from Dakota to Wisconsin. And so it would be a recommendation of staff, but it would of course be a council decision whether that's a requirement or not.
Okay. Great, thanks, Craig. Rebecca?
So, Craig, if this deal goes through, who will pay for that that connected extension? Does the city residents do it, pay for it then?
Yeah, I think if this agreement moves forward, the city still has the right of way, so that in the future, if we want to build the road, we can. There's about, in my estimation, about 250, 260 feet from the edge of the cul-de-sac to their property line. So, you know, we're not talking about an interstate that needs to be built. It would be about 250 feet of roadway that would be likely borne by the city.
How much does it cost to pay 250, to pave 250?
You know, that's a tricky question, especially given the terrain out there and the current vegetation, but it's a significant amount. You know, I don't think I even want to put a dollar amount to it, you know, without looking at actual soil conditions and the exact topography, but think that's probably a good guess.
And then the other question I have is, when the quarry went through, are they required at all to pay for part of that road construction?
The quarry will, as part of their conditions, have to improve Marina Crest to the property boundary, to what would be their westerly property boundary.
So the city is assuming this applicant's costs to do that section of the road then by brokering this deal?
I'm not sure that's entirely fair. I think it would be fair to say that if the city wants to complete the roadway in the future, with this deal, there won't be any additional subdivision, and it would be a city project. I don't think we could say that we're accepting their cost per se, but yeah, in the future, if the road's going to get built, it's going to be a city project.
Not for Craig, but for...
Hey, Craig, sorry, before you go.
Question for Wendy.
Ben has a question for Craig real quick, Rebecca, then we'll go to Wendy.
Can you talk for just a second, why would it be a staff recommendation to extend the road? Or what's the community purpose that we get?
Why would it be a staff recommendation that the road be extended? You know, so in general, our goal with any transportation network is to improve connectivity, you know, and you know, I wouldn't say create a grid system, but we definitely want to improve the connectedness of our existing transportation network. And there's currently a fairly significant distance between Skiles and Labrie in one's ability to connect from Dakota to Wisconsin. So one of the goals of the transportation network being to improve connectivity would be, let's try and get another east-west connector. So that's why staff would recommend it. I think we heard fairly loud and clear from that particular neighborhood when the quarry was improved that, or approved, that the neighborhood doesn't necessarily want to see that roadway. And so I think that's where it kind of goes from staff to council to really determine, what's in the best interest of that particular neighborhood or the city as a whole. But our engineering standards and our master plans are basically intended to look at the entire city and the entire network, and so that's why we'd recommend it.
Thanks, Craig. Question for Wendy, Rebecca?
So Wendy, could you just speak to just a general, if we were to go through the subdivision process for this project, what would we get for the affordable housing program? Like,
is it 4 lots? Is it a 4-lot subdivision? So it'd be 20%, so it'd be 0.8 of the, was it $77,000, I think right now. I thought it was a 5-lot. Wasn't it gonna be just 4? Yeah, so it's 0.8. So it's a portion of the full rate.
okay.
So it's 80% of the full.
And, okay, so that's a benefit to the city as well. Okay, I just wanted to quantify kind of like what we're giving up with this brokering this deal. Not that we can't change things later, perhaps, but what I've seen is usually we don't. All right, thank you.
Thanks, Rebecca. Further comments on the motion, the original motion? All those in favor, please raise your hand. Those opposed, like sign. And the motion carries on a 3-2 vote with Councilors Davis and Norton voting in opposition. We'll move on to item 8, communications from our police chief Dial. I would ask, just in the spirit of time, if we can maybe move through these last remaining items pretty efficiently, which I know we always try to do, but we will move on to what will be ordinance 20-10, an ordinance adding a new chapter to Title 7 prohibiting the storage, placement, and maintenance of personal property in a manner that interferes with the use of public property on a first reading. Chief.
I really feel love when everybody got up and left when I came up here. Before you is a proposed ordinance, as the mayor stated, prohibiting storage and placement of and maintenance of personal property in a manner which interferes with the use of public property. about March, first part of March, my staff and I were talking about certain challenges we have, and many of you on the council, especially Andy and John and Frank, we've gone through this every year. What do we do about transients? And is this just a target transients? No, it's not. But regularly, every summer, we receive complaints about transients using the pavilion, and in the pavilion are their backpacks, their duffel bags, their water jugs, their pit bulls, on and on and on. And we really had nothing that we could do to make them relinquish part of the pavilion, part of the sidewalk, part of a bench to those people, other people who want to use it. So one of my detectives, Detective Shook, wrote this ordinance. We thought it would be a good addition to our current ordinance to help us manage the issues we do have with those people who are not willing to share public venues with other people. And that's what the ordinance is all about. And that's why we recommend that you approve it.
Thanks, Chief. Any questions for Bill on the staff report? Not seeing any. Got off easy tonight.
Thank you.
Thanks, Chief. Discussion, motion? Something we've certainly discussed for years. Rebecca?
Well, do I need to make a motion to, don't we have to have a?
Are we still under?
Public?
No, this is not advertised as a public hearing, Rebecca.
So I just make a motion
It's
to
just a
approve.
motion on ordinance 20-10.
Okay, make a motion to approve ordinance number 20-10.
Okay, is there a second to the motion?
I'll second.
Seconded by Councilor Sweeney. Further discussion? All those in favor, please raise your hand. Those opposed, like sign, and that motion carries unanimously. Thanks, Bill. We'll move on to item 9, communications from Ben, our finance director, regarding item 9A, resolution 20-19, a resolution requesting distribution of bridge and road safety accountability program funds. Ben.
Good evening, Mr. Mayor and Council. I'm here to talk about the BARSA distribution resolution, and in order to request the distribution of BARSA funds, which you read into the record as Bridge and Road Safety and Accountability Act funds, the resolution must contain 3 items, and that's noted as A, B, and C in the staff report, and they are included in the resolution as well. The amounts available to the city for the fiscal year 2020 are $180,886.04 and are used for the Monaghan Road project that Public Works has completed. It's also a project that is in conjunction with Trailview Development and using some impact fee funds as well. May I answer any questions that you may related to the resolution?
Yeah, thanks, Ben. Any questions for Ben on his staff report? When did BARSA come into effect? It was a couple of years ago, wasn't it?
Yes, but I don't know.
Basically gas tax revenue?
It is an increase in gas tax revenue, but I'll plead the new guy here at the city of Whitefish
Not a
and
fair
to the state of
question.
Montana in general, and I don't know when that law went into effect, so I'll
That was the 2017
Legislature, okay. Great.
Thanks, Dana.
Thanks, Ben. Any questions for Ben? Appreciate it. We'll need a motion to that effect, please. Rebecca.
I make a motion to approve the resolution requesting, is it resolution 20-11 or?
19.
Oh, sorry. Wrote it down. A resolution requesting distribution of bridge and road safety and accountability program funds.
Is there a second to the motion?
I'll second.
Seconded by Councilor Hennon. Further discussion? All those in favor, please raise your hand. And that is unanimous. Michelle. Thanks again, Ben.
Thank you.
Dana, we're to you. You have Dana's report enclosed with the packet. Do you have any questions for Dana? And Dana, anything additional to report on?
I have nothing additional this evening.
Questions of the council? Not seeing any. Thanks, Dana, very much. You have enclosed a letter from the Lion Mountain Loop Road request to add 3 removable speed bumps. And we heard from, and I apologize, your name again? Clyde, that's right. Thanks for sticking around. And that request is enclosed as a letter with your packet. Rebecca?
I'd like to, do I make a motion, or do I just ask the other counselors if we can charge the Public Works to change this to a three-way stop?
I think we should ask Craig's opinion
Oh,
first, and then we can have a discussion.
Because I think he
And-
came up with the idea of coming to council. Craig?
Craig, you available? No, thanks. Didn't see you back there.
So this is a tricky one, and we struggle with speed control. I don't know how the chief very selectively decided to leave the room here, but we struggle with speed control throughout the city, and it oftentimes have requests for speed bumps or stop signs. Speed bumps become tricky because they actually, both speed bumps and stop signs, in our opinion, tend to have a somewhat negative effect on speed. Although it does slow vehicles down, either to stop or slow down for the speed bump, you have a tremendous amount of acceleration after that speed bump or stop sign, which tends to actually exacerbate the issue. And so we like to use other forms of traffic calming, whether it be reducing lane widths, parking cars on the sides of the road, speed radar signs, which we've been using more frequently lately. And the new speed radar signs that we have, we can move around town, and they actually have data loggers on them, so the police department can use the data from those speed radar signs to kind of target what times of day, or where the speeding is the biggest issue. But I would not recommend that we turn Mountain Park and Lion Mountain Loop into a three-way stop, especially for the downhill traffic. I think we're going to see an increase in the speed between Mountain Park and State Park Road.
Meaning you don't recommend that we install these?
The stop signs.
The stop signs, okay.
I'm sorry, did I say speed radar or something? I don't recommend the stop signs. I know the original request was, came through as speed bumps or some type of speed hump or, deterrent, which was just recently, I believe, earlier tonight, revised to stop signs, but I would not recommend it.
Would you recommend removable speed bumps?
We used them during the detour, and I think we saw some success, but I wouldn't recommend the speed bumps for a long-term solution. I think we need to look at other types of traffic calming for that stretch of roadway if we really are seeing a speeding issue.
We have removable speed bumps on Cougar Ridge, correct?
They may, but I believe Cougar Ridge is a private road.
It is?
Yep.
Didn't know that.
What would you recommend for this case?
I don't have a real good recommendation. I mean, honestly, the pavement condition out there is not great. I think that's one of the things that does actually calm traffic, is the fact that it's not a great roadway, and if we repaved it or did a mill and overlay, we'd actually increase traffic. I don't know, Chief, did you come back? Do you have any enforcement ideas or anything for this stretch of road? I think, oftentimes when we improve a roadway and add curb and gutter, we have the opportunity to reduce lane width, but it's not currently an urban roadway. It's a rural road with ditches, and that type of a construction project can be obviously fairly expensive. I guess I'd probably continue to work with the speed radar signs at this point.
Chief?
The speed radar signs have shown a significant reduction in speeds where they've been put up, and I think I've advocated before that all new road construction should have that as a mandate, that that we put those in. That way we can that actually records the speeds, gives us average speeds, maximum, minimum speeds, so that we can concentrate our efforts. as we've been accused of having 6 people at one time. And so, with our resources of having 2 people on, we can target certain areas that we do look at speed enforcement. But as Craig said, stop signs actually increase speed because people will accelerate quickly after they leave a stop sign. So,
In your opinion on speed bumps?
speed bumps are fine, but I know my red compatriot back there, and Joe doesn't like them for the damage it does to them, and I know the residents don't want to hear them, but they do work.
Rebecca?
I kind of feel like we're abandoning the neighborhood's concerns by not coming up with something. Could we just put it on your radar and have you report back to us if you come up with something? Like, besides nothing? See what I mean? They're identifying an issue, and then we're saying, no, you can't have this one or that one. Live with it. And so maybe there's another thing that we just haven't thought of yet.
I think typically what council would do is direct the city manager to work with staff on that if there's a consensus.
That's all right.
I forget that.
Quite all right.
I'm sorry. Okay.
Would you like to provide some direction to staff?
Well, I don't want to step on toes, but I also feel like, sometimes if you just let things go around for a while, new ideas can come up. And so I'm wondering if we could not just say no, but maybe look at other things that might work in the future.
I'm in favor of that. Any thoughts from the council? I guess one idea I had is, I know in your letter, sir, that you did mention the increase in traffic that you're observing from obviously the Lion Mountain Trailhead and recreationalists using that, et cetera. I'm wondering if Dana, I don't think Maria's here, but if we could reach out to Whitefish Legacy Partners and see if we can address that in cooperation with them to have some additional signage placed.
Yep, we can absolutely work with them. And Maria is watching, so she's been hearing everything. So,
okay, great.
We'll work with Legacy Partners to see what we can do.
Yeah, I think that's a very fair request, and I've observed it myself, biking in that area, not on your road. Anyway, thanks for sticking around. We've asked staff, including our police department and public works director, to monitor the situation. Right now, they're not in favor of the removable speed bumps, but we can get what's the term, Craig? The speed radar system installed and start collecting actual data and see what the extent of the problem is. And certainly, to Rebecca's point, we're not abandoning you, but we just would like some additional information before we just start installing speed bumps, because it's not something we do frequently within the city, and I can say that having sat up here for 15 years. So just not a standard practice we like to employ. So, yeah, thank you. We'll move on to item 11B. You have a letter from the Solberg Family Glenwood Trust for safety buoys for Whitefish Lake Sandbar area. And just to summarize, they're requesting about $3,500 to purchase and install, and they voluntarily maintain these buoys, and they have been for decades, just as more of a boat safety issue. I guess my first question for Angie was, do we even have the authority, or is it with FWP?
It would be with FWP.
That was my thought. If FWP were to agree, I guess I'd entertain a request to help, pay for those buoys, because I do think they provide a broader public benefit than just, these particular neighbors that have requested these. But I think first they need to circle back with FWP, and I believe they'll require a permit, since it's attaching to the actual lake bed of Whitefish Lake, which is outside of our jurisdiction.
I've driven a boat on that sandbar before. It's terrible.
Must be fun.
Yeah,
Is that correct, Ange?
Yeah,
Okay.
that's accurate. They would need a permit, and again, we don't control the water. That's FWP.
Okay. Do we mind, can we just give a quick response back to Dick and Jane and the other groups and just let them know that they need to apply to FWP?
Sure.
Okay, I appreciate it.
And I assume that request would be for funding also?
I would first like them to go to FWP before us.
Exactly, yeah.
So-
Request for a permit and then funding also. Because I was sitting on my deck about 2 nights ago and watched somebody in their $150,000 bladder boat that I knew was inside of the buoy grind out their prop. It was like, ooh, that hurt. But anyway, so, but yeah, it is, I mean, it is a safety hazard for sure.
Yeah.
I mean, I've seen boats hit that at high speed and there could be a bad accident there in a really low water year. So something needs to be done, but it should be FWP's responsibility, not ours.
Well, I think what we're asking is for them to seek funding through the state, through FWP, and if they fall short, they can always come back and see if we have some funds that we can contribute. And of course, we'd have to, vet that with Maria. I think we've covered that. We have a letter requesting support for the Great American Outdoors Act. I believe we've drafted a letter to that effect.
Yeah, there is an example in your packet. There's one correction because I believe this should go to Representative Gianforte at the federal level, but we'll update that other than it going to Representative Fern. So,
Okay.
but that is the draft that was sent out. It's an important bill that the Senate passed on to the House, and it has to do with our land water conservation funds that we're using at Armory Park, and it would require annual allotment to that program.
Okay. I'll be in town through tomorrow night. If that letter's available for my signature, I can swing by. Unless you want to sign it, Dana, that doesn't matter to me.
I think it probably is best coming from you. If you are back in town on Friday, though, the vote, I don't think is scheduled to go until late July, so I think we have
perfect.
time to
Okay.
get it to them.
Great.
Yep.
I'll circle back with you. On that note, I have nothing further this evening. Ben, anything further to add? Okay, Frank.
Mayor, I'm going to beat a little bit of the horse again. I want to emphasize to everybody that showed up this evening and everybody in our community, the vast majority of people that responded to us on our resolution were begging us to do more. They asked us to do more. They wanted an actual ordinance that mandated this. After some considerable discussion, I quite frankly recommended that we start, and John agreed that we should start with a resolution in hopes that our community would come together behind protecting one another, protecting our businesses, and honoring and respecting our visitors as we would want them to honor and respect us in this community. It is in that spirit that I think we passed that resolution. And I hope that all that attended this evening and all the comments that we got will take that resolution with that spirit in mind. Make no mistake, this is a public health issue that has been foisted upon this small community because our national leaders and our state leaders cannot seem to get their act together. I am more frustrated than I can be by the fact that our businesses have not taken this on heretofore to date as something that they could do to respect their employees and respect their customers and ask their customers to respect them. That's what it's about. It's not about restricting your rights. It's not about restricting what you can and can't do. It's about showing a little respect for your fellow man. And it's with that, I was very pleased that we were able to take that step this evening. And I hope the community will take it on in that spirit because that's the way it was intended. Thank you. That's all I had.
Thanks, Frank. Well stated. Ryan.
Nope, nothing.
Thanks, Ryan. Andy. And Rebecca.
I really appreciate all the diverse opinions we got in this decision for masking. It's a very surreal situation when you have a pandemic like this. Nobody's lived through it before, and so we just have to trust that we're making the best decision at this point. Again, there are going to be people that are not masking. That's okay. Don't make an issue about it if they're not able to mask. Just step away from them because you don't know if they might be an asymptomatic carrier. Give everybody space. Everybody's coming at this from their own viewpoint. and we all have different ways of processing complex information. But try to celebrate that we have a community that cares enough to have over 500 comments submitted about this. As a decision-making process, it's quite beautiful, really. So I'm happy to see that everybody cares enough to try to get to the truth of where we're at with this pandemic. And again, if you can't breathe in a mask, if you have anxiety issues, emotional issues, PTSD issues, it's okay, don't wear a mask. But protecting yourself also means you step away from other people, because you don't know then if they could be an asymptomatic carrier as well. Try to be gentle through this process. I've worked in healthcare a long time, and it still takes me a long time to remember not to grab my mask here and to remove it like this. And, you know, I have a lot of different types of masks I'm working with to see if I can get back to work and how that's going to go, being 2 to 3 feet away from people. And so just be gentle with the process. Try not to, you know, stir the pot too much, and trust that as our community moves through this pandemic, we might have to implement more suggestions that are coming from health officials above us, government officials above us. Try to keep an open mind. But I really do appreciate everybody showing up for this process, and especially the council for taking it on. And then my last comment is, it was the 4th of July, and I started thinking about the leadership in our town, and I was thinking what an amazing leader Dana has become in such a short time. And John and Andy, you guys leading us on council, and how truly blessed we are to have people that have integrity and honesty and are trying to continually do the right thing for not only our small community of 8,000 people, but 25,000 people that come here to visit. So I appreciate it now that I'm part of the government. I appreciate being led well. Thank you.
Thanks very much, Rebecca. Those were kind words. And on that note, thanks everyone for coming tonight. We're good? All right, we're adjourned. Thanks.